welcomes all. Thanks for stopping by, answering the call. Ups and downs are normal for some of us. Many days I beg to get off this life bus. Neon lights flicker, a shadow on the wall. Dreams on the ceiling, we run and then we fall. Sharing stories over paper cups. Wheels keep turning but never enough. Life's a ride on a rickety old track. Holding on tight, never looking back. In the rubber and motor room we confide. Laugh, cry, love in this crazy ride. Dusty postcards from the edge of nowhere. Heartbeats echo in the electric air. We dance on tables without to wait. Cry in the rubber and motor room, we're all high.
Hello. Hello. Is this thing on? Good. What is today? Thursday, August 6th, 2026. We are on day 8. Let me refresh and get my thoughts together. Day 8 of the Lindsay Clancy trial. Today we will see quite a few things on the witness stand. I can tell you I've seen the medical examiner, I've seen a pediatrician, and I've seen Mr. Clancy, as in Patrick's dad. So while I run my little welcome in little thing and then welcome y'all in, put in the chat what you got to snack, because y'all know we always start off with our snacks.
Get ready for the ride. Buckle up tight. Grab your snacks and enjoy the show.
Hi, if you're new here, my name is Sheila. Rubber Ramada Reviews. We do trials. We do trials on a speed trial. We cut the crap. We cut the fluff. We don't do the breaks. I can take your 8-hour day you sit and watch a trial, and we can slam, bam, thank you, ma'am, all into usually less than 4 hours. So thank you all for being here. Mustang was A1 first in here this morning, and Southern is here too so far. And as they trickle in, you know, we just give that extra hello, hello. Today, my snack is popcorn. Look, I actually have popcorn today, and I brought a Diet Dr. Pepper, but I'm not real happy with that. I will probably end up going to the kitchen and making my coffee, because y'all know I need my 32-ounce cup of coffee. I also secretly have some Mexican candy. It's a thing in my house, but it has to stay hidden in my desk because, all the diabetics around here. I don't eat a lot of candy. Every once in a while, I get a craving. So I have my caramels. So today's been crazy. What little bit I did watch with the trial. Oh, really quick note. So you see over here on the side of my nose? Wait, where it's on this side. Look, my camera's the wrong way. This side. See, I have less makeup on today. When you sleep with your dogs and they sleep all over the bed, because they're not supposed to be on the bed, daddy doesn't know. Yeah, you end up, your dog rolls over and smacks you across the face. So I get to have a big old ugly mark on my nose today. Thank you to Lola. So let's start the trial. Of course, as always, they start off and then they go to sidebar. So let me close out this. Let's make this big screen. But of course, we'll get that intro. Let's go.
This court is now in session. Please be seated.
Good morning, Your Honor. May I proceed?
Yes, please.
Your Honor, the matter before the court today, we have Commonwealth versus Lindsay Clancy. Ms. Clancy is present. She is represented by Attorney Kevin Reddington, and the Commonwealth is represented by Assistant District Attorney Jennifer Sprague and Assistant District Attorney Shannon Buckingham.
All right. Good morning, counsel.
Morning, Your Honor.
All right. Good morning, Ms. Clancy. All right. Before we bring the jury in, let me talk to everybody just a little bit about this morning's proceedings. All right, counsel.
Sidebar every morning. Y'all, I don't think we've missed a morning without them going directly to sidebar. I will tell you that the first person on the stand is, I believe, okay, there
Well,
comes the
is
jury.
represented by Assistant District Attorney Jennifer Sprague and Assistant District Attorney Shannon Buckingham.
All right. Well, good morning, everybody. Nice to see everybody again. Thank you for being here. What I'm going to do is ask you those questions again, and then talk a little bit about today's schedule. First question.
I wanna
you
hear
should
a
probably
schedule.
know by now is, has any member of the jury read, seen, heard, or overheard anything from any source about any aspect of this case that would affect your ability to be fair and impartial as a juror? Last question is there any other serious matter or concern bearing on your service as a juror in this case that anybody needs to bring to my attention at this time? Again, thank you for following those instructions. Today's schedule is, we have a number of witnesses. We're going to start as soon as I'm done talking, and then we'll get right back into the Commonwealth's case. We'll take a break mid-morning, and then we'll continue till 1 o'clock, and then I anticipate that we'll go somewhat into the afternoon, but we'll just kind of have to see what the evidence is, if any other issues come up that I have to deal with that doesn't concern you. So with that, I'm going to turn this over at this point to the Commonwealth. Ready to call your next witness?
Yes, Your Honor. The Commonwealth calls Dr. Kimberly Springer.
Just for the record, we do the same objection.
Good morning,
Same rule.
Anna. Thank you for being here. If you would like, if you back out and you go to the horizontal, I have more people in a horizontal chat. If you would like to chat with the others about the case. And welcome in. If you're new here, thanks for being here. We do speed trials. Hit that thumbs up if you like the stream. Share.
All right, good morning,
Subscribe.
Doc.
Good morning.
Okay, I will tell y'all, this is emotional for Lindsay. You will see her break up during this. It was kind of hard for me to
Can I
watch.
see Counselor Sylvia for a second?
Oh my God. Did he really just do that? I don't remember this morning. He really just went to a freaking sidebar. Sir, we just got here.
Does that work better for everybody? Okay, all right. All right, Commonwealth.
Thank you, Your Honor. Good morning. Can you please state and spell your name for the record?
Yes, it's Kimberly Springer, Kimberley, Springer.
Where do you work?
At the Office of the Chief Medical Examiner in Boston, Massachusetts.
And are you a medical examiner?
I am.
Okay, real quick. They do not show the autopsy photos. During that time, they do have the camera on Lindsay, and you can see she's visibly upset. While this lady is talking, I'm going to go make that coffee that I really regret not getting and having my Dr. Pepper. So I'm here listening.
How long have you done that?
20 years.
Can you describe for us your educational background?
Yes, 4 years of college at Wellesley College in Wellesley, Massachusetts. 4 years of medical school at the Chicago Medical School in North Chicago, Illinois. 4 years of residency training in anatomic and clinical pathology, which is hospital-based pathology at the Brigham and Women's Hospital in Boston, Massachusetts. And 1 year of fellowship training in forensic pathology at the Office of the Chief Medical Examiner, which is where I now work.
And throughout that 20 years at the medical examiner's office, have you conducted autopsies?
I have.
Approximately how many?
Over 2,000.
And have you testified in courts in the Commonwealth about these autopsies?
I have.
Can you explain to the jurors what is an autopsy?
Yes, an autopsy is a tool by which we examine the whole body in an effort to determine cause of death. And it's comprised of two parts: an external examination, where we look for identifying characteristics such as height and weight, evidence of medical therapy, and evidence of trauma and disease. We may take evidence as appropriate, and then we turn to the internal examination, making surgical-like incisions and examining each of the internal organs, again, looking for evidence of trauma and disease, and taking additional samples for other tests, such as toxicology.
And I want to direct your attention to January 29th, 2023. Did you perform an autopsy on Callan Patrick Clancy?
I did.
And when you performed this autopsy, did you follow the procedure you just described, where you did an external examination and then an internal examination?
Yes.
And can you tell us what your initial observations were of Callan when you started the external examination?
Yes. So Callan had some therapeutic procedures in place, or therapeutic equipment in place, including a thermometer in the left nostril, a nasogastric tube in the right, an endotracheal tube down the throat, a Foley catheter draining urine, intravascular catheters in the right hand and right wrist, and an intravascular catheter in the left foot. There was some adhesive residue, possibly from other therapeutic procedures as well, on his chest. And there are additional needle marks that I saw on his body. In general, should I keep going? Or?
Well, what were your general observations?
In general, he was, we measured him at 26 inches long and 24 pounds. He had general edema, and those are the general.
So when you were talking about therapeutic things, are those things that were done by a medical provider at a hospital or some such setting?
Correct.
Okay. And what do you mean when you say he had general edema?
It means that he had his whole body had more fluid than one would expect in a person, or an 8-month-old who had not been in the hospital. It's very common for someone coming from the hospital to have had been given fluids such that they have excess fluid and swelling.
Did you make observations of any injuries or trauma to Callan?
Yes.
Okay. If we could have photo 9960.
Hold on, let me just, members of the jury, I just want to give you, kind of revisit that instruction that I talked to you last week about. If you may remember, we talked about before they played that tape, all right? I just want to remind you that sometimes evidence is presented in the trial that creates emotional reactions. But as jurors who've taken an oath to follow the law, I'm instructing you, as I did last week, you must separate any emotional reaction on your part from the informational value and the weight from the evidence. You must not be influenced in any way by the unpleasant nature of the photographs and testimony that you're going to hear this morning or throughout the whole trial as well. So you must find the facts in this case based only on the evidence. But you can't find those facts or base those facts on sympathy, anger, passion, prejudice, or pity against either side. So I appreciate that. I just kind of wanted to remind you of that. And with that, come on.
Thank you, Your Honor. So photo 9960. Is that on the screen, Doctor?
Not yet. Yes. Okay, thank you.
If you could just describe for us what we're seeing here in this photo.
So this is a photograph of Callan at the time of autopsy, and I'm showing a ruler underneath his neck, where above which you can see abrasions, and you can also see some needle marks that I mentioned from therapeutic procedures on his arm.
I'm sorry, if you could use the tool, pressing the top button there just to highlight the area you're talking about, the abrasions on the neck.
Right here on his right side of his neck, and then in the middle of the neck and on the left side of the neck.
And if we could now have photograph 663. If you could tell us what we're seeing here in this photograph, Doctor.
This is another photograph showing a bit more closely, again, the abrasions of the neck. There's one on the front of the neck, the shorter one that's about 1/2 inch long by 1/16 inch. For those more familiar with the metric system, a centimeter is 2.5 centimeters is about 1 inch. 1/16 of an inch is about 1.5 millimeters. So this is 1/2 inch by 1/16 inch. And then on the right here, this is about 1.5 inches by 1/16 inch.
And then showing 9952.
May I go back to that for 1 second?
Go back.
For one-
Could we go back to that photo, please? 9960. I'm sorry, 663.
I just want to point out between the ruler and the abrasions, you can see a paler line. That's a normal infant neck fold. That's not a injury.
Thank you. And 9952, please. If you could just point out for us here the injuries of significance to you.
Here, sorry, I think I did that.
We could go back to the prior photo, please.
I got it.
It's the top end.
Yep. Okay, so these again are the abrasions on the left side of his neck, and there's the one on the front of his neck. In addition, on the left side of his forehead is a 3/16 inch by 1/16 inch abrasion, and I think you can also begin to see petechial hemorrhages, which are dot-like hemorrhages underneath the skin on the face.
And what are petechial hemorrhages?
Petechial hemorrhages occur when there is rupture of the small blood vessels underneath the skin surface, and they are from an overpressure of the small blood vessels such as capillaries or venules, and blood escapes out and makes a dot-like hemorrhage.
We could have photo 9954. If you could explain for us what we're seeing in this photograph, please.
In this photograph is Callan's right side, also showing the back of his neck. So that abrasion that could be seen in the first photo showing the front of his neck, that abrasion continues along about 3 inches in all toward the right posterior back of the neck.
And if we could have photo 9955, please. Is this a close-up photograph of what you just described?
Yes, I can show that right here.
Thank you. Could we have photo 636, please? And if you could describe for us what you see here in this photo, Doctor.
First the abrasion is in poor focus, but it's in the picture on the left side of the photograph. And then the most in the photograph, one can see those petechial hemorrhages better along the cheek, on the eyelid, all of those.
We could have photo 654, please. Can you describe what we're seeing in this photograph, Doctor?
Yes, this is an abrasion near the hairline on the right side of the forehead, and that is up here. That is about 3/8 by 1/8 inch.
And then photo 656, please. Can you describe what we're seeing in this photo here, Doctor?
This is looking at the top of Callan's head, and on the top right part of his head towards the front, near the forehead, is a 1/8 by 1/16 inch abrasion.
And then photo 657, please. You can describe what we're seeing here, Doctor?
This is the abrasion on the left side of his forehead with a ruler this time. In addition, the petechiae are also in pretty good focus on this.
And then photograph 9916. If you can describe for us what we're seeing in this photograph, please.
So these are some of the, I forgot to mention at the very beginning, there's a intravascular catheter in the right groin. This is Callan before we took off his medical therapy, and it shows some of the needle marks that he had. So on this is his right lower extremity. This is a look of an intraosseous catheter attempt with a central puncture mark and a round abrasion around it. And then here's the right groin line and the left foot line.
And if we could have photograph 9917. Are we seeing the same thing here on the left leg, those same IO attempt marks?
Exactly, yes.
Thank you. Doctor, are you able to date the wounds to the head, the abrasions and marks on the head? Are you able to say when those got there or how long they'd been there?
I can't precisely, but they have signs of healing in the form of scabbing.
And would that indicate that they weren't fresh wounds that happened the day you saw him or the day prior?
Correct.
In terms of the marks around Callan's neck and the petechiae around his eyes and face, did that give you an indication here of the mechanism of death for Callan?
Yes.
And how so?
It is consistent with a ligature strangulation, given that the abrasions are linear around his neck and there are petechial hemorrhages above those lines of abrasion.
And how is it that when someone is strangled with the ligature, that causes petechiae in the face and eyes?
So what happens is that the blood vessels that supply blood to the neck are compressed. And so there are jugular veins, which are a lower pressure system, and carotid arteries, which are a somewhat higher pressure system. And so as the vessels are compressed, if there is a backup of blood in the head, there can be an increased pressure in those small blood vessels that I mentioned, and they can rupture, causing the petechiae.
So basically, is it similar to a balloon filling up, but it's not air, it's blood and pressure in the face?
Yes.
And so when that pressure gets too great, is it that the capillaries are basically bursting and causing those little red marks?
Yes. Most texts say capillaries, some say venules, the small blood vessels.
And how is it that this process, the strangulation by ligature, causes death physically? How does it physically happen?
So the blockage of blood, either both to and from the head or just from the head, will cause a lack of oxygen to arrive at the brain. And there can be an element of airway compression as well, such that the lungs can't oxygenate properly. So that lack of oxygen is what causes the brain to die and the organs to fail.
And based on your examination of Callan, did you come to a determination based on your training and experience to a reasonable degree of medical certainty as to the cause of his death?
Yes.
And what was that?
Complications of mechanical asphyxia.
And why is it complications of mechanical asphyxia instead of just the asphyxia itself?
Because he was resuscitated, and so his heart began to beat again. So from the 24th to the 27th, there was a continuation of support of his organs in the hospital. And so if he had a stopped heart at the scene, and in that case I would have just said mechanical asphyxia, but since there was a 3-day hospital stay, I said complications of mechanical asphyxia.
So the word complications doesn't mean that something happened at the hospital to cause his death. It's just that the strangulation caused his death, but he didn't die for a few days.
Correct.
Commonwealth would move to submit the autopsy photos as the next exhibit.
Same objection.
Same objection. They may be admitted.
Commonwealth would move to submit the death certificate of Callan Clancy as the next exhibit.
That may be admitted.
I have nothing further.
Counsel?
Thank you.
All right. Thank you. You may step down, Doctor.
Thank you.
All right, Counsel, can I see just briefly?
Unmute. I know that was emotional for her. They take a break. That monitor was on in front of her during all that, so I know that was.
Lindsay Clancy, all parties are present, including the defendant, excluding the jury.
All right, counsel, we ready for the jury?
Yes, Your Honor.
All right.
Officer Bilal, bring in the jury. Court, all rise. Jurors entering. Just watch your step, please.
Good morning, Doctor.
Good morning.
Attorney Sprague?
Thank you. Good morning. Can you please state and spell your name for the record?
Lindsay Rosshirt, LINDSAY ROSSHIRT.
And what do you do for a living?
I'm a pediatrician.
Where do you work?
I work at Quincy Pediatrics.
Back in 2023, where did you work?
South Shore Medical Center.
And how long did you work there at that point?
In 2023, I think I had been there for about 7 years.
And could you just briefly describe for us your educational and training background that enables you to be a pediatrician?
Yes, I completed medical school at UConn and then did my pediatrics residency at Mass General.
And when you were working at the South Shore practice in 2023, were you assigned as a pediatrician for the Clancy family?
Yes.
And how long had you been their pediatrician?
I'm sorry, how long had I, can you repeat that question?
How long had you been the family pediatrician for the Clancys?
I believe I started seeing them around 2019.
And in the practice that you were in at that time, was it just yourself or were there other doctors and nurse practitioners and staff that would treat and see patients?
It was a somewhat large group.
And so would you always be the one treating the Clancy children, or would some of your associates sometimes see the children?
I did all the checkups, but if there was a sickness and I wasn't there that day, they would be seen by another provider.
And by checkup, are you referring to a physical or well visit?
Yes.
And then if, for example, one of the children were ill and the family called to make an appointment, they would see who's available?
Yes, they would always check my schedule first, but often have to see someone else.
And would you have access to their records as their lead pediatrician to review if they came in for a sick visit or something like that to keep yourself updated?
Yeah, often at the time of the checkup is when we will go back and see what visits they've had since the last time we saw them.
This time would move to submit the pediatric records from South Shore Medical Center for Cora, Dawson, and Clancy.
Any objections?
By agreement.
That may be admitted.
If we could focus for a moment on Callan Clancy. He was born in May of 2022, correct?
That sounds right, yes.
And you were his pediatrician from the time he was born?
Yes.
While you were his pediatrician, did his mother, Lindsay Clancy, ever talk to you about Callan having issues taking a bottle?
Not that I can remember.
Was there anything out of the ordinary health-wise with Callan?
No.
Was there any issues, or were there any issues with him meeting his milestones?
No.
What about Dawson Clancy? Did he have any health issues or concerns that you were aware of?
If I recall correctly from the notes, I think just a peanut allergy, if I remember, but otherwise he was healthy.
And Cora Clancy, did she have any medical issues?
I think asthma, that was pretty well controlled, but she was also healthy.
Now, in your role as a pediatrician, are you aware of postpartum issues, and are there certain things that you look for in new moms when you're treating babies?
Yes, we're certainly aware of it, and we try to look for any kind of outward signs at some of the initial newborn visits. Do you want me to elaborate?
Yes,
on
please.
that? So, for example, things we might look for would be if a mom is kind of has a flat affect, or not really making eye contact, or tearful, or having trouble bonding with the baby.
And if there are those issues that you see, do you document them in the medical records?
Yes.
And what do you do in terms of treatment or care when you see those things?
Yes. So since we're obviously caring for the child, we are not really able to diagnose or manage anything for the mom, but we do try to connect her with resources, whether Massachusetts has some postpartum resources, or often we'll refer to have her try to contact her OB.
When you were interacting with Lindsay Clancy, when you were treating her 3 children, did you ever see the need to refer her for any of those services?
No.
And did you ever see any of those visible signs that you talked about, the flat affect or anything like that, when you were interacting with her?
I don't remember anything like that. No.
I want to ask you about some of the things that are in the medical record that the jurors will see, so that you can just kind of explain what they'll be looking at. Showing you a record here from January 18th, 2023. Issues with the brightness, I'll just bring it to you. You just look that over, and is that consistent with the medical records from your practice?
Yes.
And so, for example, with this visit, Callan Clancy, 7-month-old male, here with mom for bilateral ear pulling and fussiness. So is that typical in the medical records, where you'll document the patient being seen, the age, who they're there with, and what the issue is?
Yes.
Okay. And how do you get a history? Say when a kid comes in and they're sick, how do you get the history of their symptoms and what's going on with them?
So we usually do a brief review in the chart just to know what their anything on their so-called problem list for medical conditions, and then in the room we ask the parent the story. In pediatrics, usually we have to rely on a guardian,
especially when it's like a 7-month-old who can't speak for themselves. So it would be whichever parent or person is there giving you their concerns and the symptoms, and communicating with what's going on.
Yes.
And if there were any issues with communicating with the parent present, would that be documented in the medical records?
Yes.
And you saw Cora Clancy on January 24th, 2023 for a physical, correct?
Yes.
And as you stated earlier, prior to seeing her for the physical, did you look over her chart to see if she had been in recently with any illnesses or anything like that?
Yes, I would have done that.
And so would you have seen this note when her mother brought her in on December 27th, 2022, with some vomiting and sore throat?
Yes.
And again, if there had been concerns at that appointment, they would have been noted in the record?
Yes.
And then as the pediatrician, if you'd seen some concerns, would you have addressed them with the parent?
Yes.
And that didn't happen on January 24th, correct?
Correct.
And speaking specifically to January 24th, 2023, that was Cora's 5-year physical, is that right?
Yes.
And sometimes in the record, it's called a well visit?
Yes.
And what were your observations of Cora that day?
As far as I can recall, it was a very normal visit. Cora seemed to be behaving normally. I mean, no kid's happy to be there for a checkup, but I didn't notice anything out of the norm. She seemed perfectly well behaved, and mom seemed appropriate as well.
Mom seemed appropriate?
Yes.
Did you notice anything out of the ordinary about Lindsay Clancy's demeanor or behavior or interaction with you?
No.
Was she able to give you a history of how Cora was doing and what milestones she was meeting?
Yes.
Was she able to answer your questions?
Yes.
Did you have any trouble understanding her at any point?
No.
Did she seem to have any trouble understanding you?
No.
Did she have, visible tears or a flat affect or anything like that?
No.
Did you have a discussion with Lindsay Clancy about Cora having some stomach aches?
Yes.
And what was your evaluation of that and your recommendation?
So we talked about the belly pain she was having. It, from what I could tell, I thought constipation might be possible because it's something we see a lot in kids. So I had suggested we try Miralax, which is a common stool softener we use, and wanted her to see me within 2 weeks if Cora wasn't feeling better.
Okay. And when you recommended the Miralax, was Lindsay Clancy receptive to that?
Yes, I believe so.
I have no further questions. Thank you.
Attorney Reddington.
Morning.
Good morning.
What's the time frame that you dealt with the Clancy children? Because you took care of all three of them, right?
All three.
Right.
Yeah. Cora, I believe, was around 9 months old. So I want to say that I saw them from about 2019 until 2013.
And when you would see the children, who would bring the children to see you for the checkups? Was it Lindsay, or was it Lindsay and Patrick, or was it?
I think that Lindsay and Patrick came together for one of Cora's checkups, but as far as I can remember, every other visit was always Lindsay.
And being an experienced pediatrician and being very protective of your patients, little kids, you're always looking to see if there's anything out of the ordinary, bruising, anything indicative of any type of psychiatric problems they may have, stunted growth or anything. Is that correct?
Yes.
You're always on the lookout for anything else, even if it's not mentioned to you, right?
Right.
Did you ever notice anything like that on the Clancy kids?
No.
Did they seem healthy?
Yes.
Did they seem happy?
Yes.
And in all the times that you would see Lindsay with the kids at your office, did she appear to be a doting or concerned mother for the children?
Yes, she did.
One of the questions that the DA had asked you is whether or not you're familiar with postpartum depression, postpartum psychosis, things of that nature. Would you agree with me, in your experience, extensive as it is, that a person can be suffering from postpartum depression and or postpartum psychosis and still talk?
I'm not sure I have enough expertise to explain to answer that well.
That's fine. That's fine. Thank you.
Yeah.
Was Lindsay the type of person, to your observation and your treatment of her, that she was kind of like, was she like a complainer? Would she complain to you about the kids being a pain in the neck, and that she was aggravated with the children or anything like that?
Not that I remember, no.
In all of the times that you had seen her, let's focus, say, on the year of 2022 up through 2023, January 24th, when you saw the children, I'm sorry, Cora, I believe it was, last. Counsel had asked you whether or not you made any observations that you would have noted if she appeared to be suffering from any symptomology of postpartum. Do you recall her asking you that?
Yes.
And in your treatment of the children and in your observations of Lindsay, did you know, or did she indicate to you, or did Patrick indicate to you, or anybody indicate to you, that in October of 2022, she was seeing a psychiatrist?
No.
Do you know Dr. Tufts?
No.
Did you know that after seeing Dr. Tufts that she was placed on a selective serotonin reuptake inhibitor, SSRI, Zoloft?
No, I didn't know that.
And again, you're the pediatrician. It's not your job to pry. I mean, if you see something, you would make note of it and try to help them out. But I mean, if they don't tell you, you don't know, right? Did you know, fair to say that you didn't know that she was then seeing a Dr. Paul, and then Paul left the practice and nurse practitioner Gelada?
I didn't know that.
Okay. Do you know them?
No.
The only reason why I ask if you know them is that South Shore Medical Center, is that affiliated with South Shore Hospital?
I believe it was already owned by the hospital at that time.
Okay. Latasha Dukes, nothing about her.
No.
Any medications? Did you know about her being on any medications?
No, I didn't.
She didn't complain to you and say that she had insomnia and that she was unable to sleep, or having difficulty like that?
Not that I can remember.
Mental institution.
I didn't know that.
So when you saw her on January 24th, you did not know that she had been to McLean Hospital and had been on medications or anything, right?
That's correct.
Because again, she wasn't a complainer.
Correct.
She was a hell of a mother, wasn't she?
I always thought she was a good mom.
Thank you.
Redirect?
No, Your Honor.
All right, thank you, Doctor.
Thank you.
I'm not sure who this is. I fell asleep. I actually got a small nap this morning.
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 All right. I'm going to ask you to keep your voice up and speak into that microphone. All right. Attorney Sprague, please.
Thank you. Can you please state and spell your name for the record
Susan Fraone, SUSAN, FRAONE,
and your date of birth?
11/26/82.
Where do you work?
Learning Sprouts,
And how long have you been working at Learning Sprouts?
almost 6 years.
What is Learning Sprouts?
Preschool daycare.
What age range of kids attend Learning Sprouts?
15 months to about 5 years.
And what age range do you teach?
The about 3-year-olds to 4-year-olds.
And back in January of 2023, what age range were you focused on
The
teaching?
3-year-old, 4-year-olds.
Was Dawson Clancy in your classroom?
Yes.
When did he start in your classroom?
September of 22.
And did you know Cora Clancy as well?
Yes.
How did you know Cora?
Most of the teachers help out in all the classrooms, so we get to know all the children.
And did you teach Dawson from September of 2022 until you went on maternity leave later on in 2022?
Yes.
Do you remember what month that was in that you went on leave?
November.
Prior to going on leave, so from September to November of 2022, were there any issues with Dawson?
He started having harder drop-offs around mid-October, I would say.
Is that typical for that age, or is that something unusual?
Sometimes, yes. It was a little not typical for Dawson.
So prior to that, he was fine at drop-offs, and then sometime in October, drop-offs became a little harder for him.
Yes.
And did that resolve over time?
Sometimes he would have better drop-offs, other times. But then I went on leave, so.
And after you went on leave, sometime after Thanksgiving of 2022, did you see Lindsay Clancy, Dawson's mother?
Don't really remember. I think I did.
Do you recall having a conversation with Lindsay where she asked you how your baby was and how you were doing?
Yes, we did have a conversation at some point because I was still bringing my oldest daughter to school every day.
Okay. And so you had your child in November, and then this conversation is sometime either around or after Thanksgiving?
Yes.
And when you had this conversation and interaction with Lindsay Clancy, was that at the school?
Yes.
And how was her demeanor?
Fine.
Was it any different than any other time you had seen her?
No.
Did she appear to understand you?
Yes.
Did you have any trouble understanding her?
No.
Did you have any concerns about her at that time?
No.
Was that the last time you saw her?
Yes.
And you're a mandated reporter, correct?
Yes.
So if you had seen anything about Dawson's behavior or about the parents' behavior at any point that caused you concern, you would have had to report that, correct?
Yes.
And at no time did you make any reports about the family or the children or the parents?
No.
When you had that conversation with Lindsay Clancy sometime in November of 2022, did she ever say anything about insomnia or not feeling well or being depressed or anything like that?
No.
Thank you.
Cross.
Morning.
So how long did you, in your capacity as a teacher at Learning Sprouts, know the Clancys?
I started at Learning Sprouts in November of 2020, and Cora was in preschool at the time.
Okay. So you obviously saw the kids on a fairly regular basis.
Yes,
And forgive me, what is a drop off? What does that mean? I'm sorry.
when the parents drop the children off at school.
Okay. And when district attorney asks you were there difficult drop offs, what does that mean?
Sometimes when parents drop the children off, they'll be a little clingy or they cry. Excuse me. Or they cry.
And that would be the child would cry, maybe the
Yes.
parent either. I don't know, but
Times.
would so did they have difficult drop offs on occasion? I guess the Dawson
Yes.
would cry.
Yes.
How would Lindsay react? Was she okay? Did she seem concerned as a parent?
I wasn't seeing as much of Lindsay. I was seeing more of Patrick.
Okay. And Dawson appeared to be healthy and happy and engaged,
Yes.
as well as Cora.
Yes.
Thank you.
Nothing further.
All right, thank you, ma'am. You sit down, thank you.
Come on, man. Stop right there and raise your hand for questions. Mr. Please, watch your stuff, please.
Good morning.
Good morning.
All right, I'm going to ask you to speak into that microphone.
Okay.
All right? And keep your voice up so everybody can hear you.
Okay.
All right. Come on.
Thank you. Good morning. Could you please tell the jurors your first and last name?
Susan Bertolo.
And if you could just speak as loud as you can into that microphone, okay?
Yep.
Can you spell your last name for the record?
Bertolo.
And what city or town do you live in?
Plymouth, Massachusetts.
And where do you work?
Leaping Frogs Preschool.
Prior to working at Leaping Frogs, did you work at another preschool?
Yes.
Where was that?
Learning Sprouts in Duxbury.
And how long had you been with Learning Sprouts?
4 years.
Did you teach a particular age group at that preschool?
Yes, I taught the older preschool group.
Okay. And at Learning Sprouts, are the classes kind of divided up in some way?
They're divided by age, toddlers, younger preschool, older preschool.
And is there a particular label to the rooms that they're in? Are they referred to in a particular way?
Yes, we were sunflowers.
So your group, the 3 to 5 year olds, is the Sunflower group.
Yes.
And can you tell us a little bit about how the day is broken up for kids in the Sunflower group?
Sure. So some children came in early at 8, and then the rest of the kids came in at 9:15. And then some were half day and some were full day.
And as far as, excuse me, your role with the kids in the Sunflower room, you primarily interacted with them in the mornings, correct?
Correct.
And when the kids get dropped off, is it fair to say the bulk of the kids get dropped off around 9?
Yes.
And does that happen kind of like in a wave where parents drop off and they're kind of taken into the room as a group?
Yes. So the way our classroom was set up, we met them. They were dropped off to us at the door, and then we brought them into our classroom.
And they stayed with you in that classroom throughout the morning, correct?
Yes.
And the kids who stayed for the afternoon, did they stay with you in the Sunflower room or did they go someplace else?
No, they did not stay with us. We closed up our room, and our kids, the majority of our kids, we had a couple, went over to the Sweet Pea room, which was across the hall.
And so are you familiar with Cora Clancy, or were you familiar with Cora?
Yes.
And was she in the Sunflower room with you?
Yes, she was.
Drawing your attention to September of 2022, what was her schedule, if you can recall?
I believe she was scheduled, I don't remember the days. I think she came 3 days.
Okay, and for the 3 days that she came, do you remember if she was just in the morning group, or were there any days that she eventually did an afternoon?
So in the beginning of the year, she was 3 days and then went full day. And then towards the end of her time in our room, she did one afternoon, I believe. No, I'm sorry, one half day.
Okay, so fair to say there were always the two of you assigned to one room with the number of kids in the class.
Correct.
Now, as far as drop-offs for Cora, did you have the opportunity to interact with parents at drop-off?
Briefly.
And for Cora, who used to drop her off?
Both parents dropped off, Pat and Lindsay.
Did you see one parent more than the other?
I recall seeing Pat more, but we took turns, so we didn't really ask each other who dropped off.
When you say we took turns, you mean yourself and Karen?
Karen, correct.
Now, with the limited interaction at drop-off, did you have opportunities to interact in other ways with parents?
Yes.
And how did you interact with parents in other ways?
Email, or typically our class dojo, which is an app for the class.
And that's something that can be done on the phone or a computer.
Correct.
And were the Clancys, meaning Patrick and Lindsay, fairly active or responsive to the Dojo app?
Yes.
And do you know or do you recall who would be more responsive?
Lindsay.
How was Cora as a preschool student?
Amazing. She was wonderful.
Was she, in your opinion, ready for kindergarten?
Yes.
I'm going to draw your attention to January 23rd of 2023. Do you remember Cora coming that day?
Yep.
And do you recall who dropped her off?
I do not.
Did you notice anything different about Cora that day?
Yes.
And what was different?
She needed to use the bathroom several times more than she normally would.
And is there a reason why that kind of stood out to you, that she used the bathroom more than often?
Yes, because our classroom did not have a bathroom in it. So we would go down at scheduled times before snack or lunch. And if a child needed to go, one of us would take that child. And that particular day, she went several times extra.
And so between you and Karen, you were kind of taking her more often to the bathroom. Was she complaining of any belly pain or any other issues?
She didn't complain.
But the fact that she asked to use the bathroom was of note to you.
Yes.
And when Cora transitioned that afternoon to go to the sweet pea room with Stephanie, did you pass along those observations to the afternoon teacher?
Yes, I did, because that was something that you would want a parent to know. It was unusual.
And during that morning group, you didn't feel it was necessary to reach out to either Patrick or Lindsay to report that, did you?
No.
But you reported it to Stephanie to pass along for the afternoon?
Correct.
And on that particular afternoon, were you at Learning Sprouts during pickup time?
Yes, I was.
And that wasn't always the case, was it?
Not every day, but I often would help out in the toddler room if they needed me to stay. And that is what I had done that afternoon.
So on that particular afternoon at pickup time, did you have the occasion to see Lindsay Clancy?
Yes, I did.
And did
Good afternoon, Teresa. This is a lot today. We're actually going to even hear from a friend of Lindsay's.
you have an opportunity to speak with her?
Yep, we spoke quickly, and I just was letting her know. And she did already know, but we just spoke quickly that she had gone a few times.
So you were letting her know about Cora going to the bathroom?
Correct.
And how did she respond when you told her that?
She said, I don't remember exactly the words, but basically that she wasn't glad that she wasn't feeling well, but she already had a doctor's appointment the next day so that she would let them know.
And that interaction was fairly brief, correct?
Correct.
But appropriate.
Yep.
And they left that day. Did you notice anything different about Lindsay Clancy after you told her that or in that brief interaction than any of your other interactions with her?
No.
And you are a mandated reporter at the preschool?
Correct.
So if a child were to come in with any concerning marks or bruises or was saying something about things that were happening in the household, you would be required to report those to the Department of Children and Families?
Yes.
Any concerns or reports regarding the Clancy family at all during the time that you were Cora's teacher?
Never.
And do you recall if Cora ever mentioned to you during class, during the time that you were teaching in the morning classes, a time when her mom was in the hospital?
Yes.
And what do you recall about that?
Just that she missed her mom, and she was vocal about that.
Do you remember about when that was that she said something about her mom being in the hospital?
It was I can't remember if it was in December or January. I just remember it was said.
But fair to say it was closer in time to the last time you saw her as opposed to the beginning of the school year?
Yes.
Just to briefly go back to Cora's schedule, I know you say you can't remember exactly which day she came, but by January of 2023, Cora was coming for 3 full days and 1 half day, correct?
Yes.
Okay. Thank you.
Mr. Reddington.
No questions, thank you.
All right, thank you, ma'am. Sit down. Thank you.
The Commonwealth will tell Stephanie Williams as its next witness, please. Shall be
believe the truth, the whole truth, and nothing but the truth. Okay, ma'am, you may have a seat.
Hey, good morning.
Morning.
I'm going to ask you to speak into that microphone. Keep your
Okay.
voice up. Pull that down a little bit
Yes.
for you. That's it. All right. Counsel.
Thank you. Good morning.
Good morning.
Could you please tell the jurors your first and last name?
Stephanie Williams?
And Williams, that's just common spelling.
Yes.
What city or town do you live in?
I live in Sagamore Beach.
And what do you do for work?
I'm a pre-K teacher
And where do you work?
at Learning Sprouts Children's Center
And where is that located?
in Duxbury.
And how long have you worked for Learning Sprouts?
About 6.5 years.
What age group do you teach?
I generally teach the pre-K children, the 4-year-olds that are going to be turning 5 and going to kindergarten.
And at the Learning Sprouts preschool, fair to say that the different rooms are given a name?
Yes.
And what room did you work in, or do you work in?
Currently, right now, I work in the Sweet Pea classroom. When I first started there, I worked in the orange classroom.
And I'm going to draw your attention to the fall of 2022, September, into January of 2023. Were you in the Sweet Pea room then?
Yes,
And how many people would teachers would be in the Sweet Pea room with you?
I was the only teacher in that room.
Was it a full day program for you in the Sweet Pea room?
Yes.
And were there some kids of that age group, the 4 and 5-year-olds, that would only be there in your Sweet Pea room in the afternoon?
Yes.
Those kids, where would they usually be in the morning?
In the sunflower class.
And fair to say, the sunflower class was more academic curriculum based, and the Sweet Pea room was not in the afternoon.
Oh, in the afternoon, yes.
So tell us a little bit about what afternoons would be like.
Basically, they would go outside to play. They would be playing in the room. They would take rest time, and then they would get up, have an afternoon snack. And then if there was time permitting, they would be able to play in the classroom or color, do artwork.
And generally, the afternoon kids in the Sweet Pea room, they'd go until 4, right?
Yes.
And that was the time for pickup for most of the kids?
Yes, that's when we close at 4 o'clock.
Okay. Did you know Cora Clancy?
Yes, I did.
And how did you know her?
I was Cora's teacher when I first started at Learning Sprouts when she was 3. And then she came into my classroom in the afternoons from September to January.
So from September of 2022, when she's still 4, into January of 2023, after she had turned 5,
Yes.
she would come 3 afternoons into your classroom?
It was first 3, then it switched to 4 afternoons.
Now, when she would come to your classroom in the afternoon, what would she be coming into? Is it snack time, nap time, rest time?
Usually it would be getting ready for rest.
And would she be brought to your classroom by one of the teachers downstairs or at the sunflower room?
Yes.
And you're familiar with Susan and Karen as the teachers in the sunflower room? Now, how would you describe Cora?
She was a sweet little girl who loved her little brother. She loved to draw, play with babies, play princess. She liked Princess Sophia.
How did you know she liked Princess Sophia?
Because she would pretend to be Princess Sophia, and she always talked about it. And I had actually bought a Princess Sophia puzzle for her.
Now, I'm going to draw your attention to January of 2023, more specifically the 23rd. Did Cora come to your classroom that afternoon?
Yes, she did.
And did you observe anything different about her?
She hadn't been feeling well, and the teachers from the sunflower class had told me that she wasn't feeling that well.
Did you observe that of her as well?
Well, she did nap, and then she, when all the other children were getting up and getting ready to leave, for the day, she was reluctant to get up off her cot and was still there when her mother came to get her.
Did Cora say anything to you why she wasn't feeling well, if she just felt...
I think she just said her tummy hurt.
And so you just kind of let her rest for the afternoon. And so who picked her up that day?
Lindsay.
And so normally in pickup, does the parent come to the classroom to pick up the child?
They usually come to the door and we send the child out.
And that would just be the door of the classroom, not the building?
Because I had a door that led outside.
So on this particular afternoon, Lindsay Clancy came to pick Cora up at the door. And so what, if anything, did you tell Lindsay?
I told her that Cora had napped and she had said she wasn't feeling well, that the other teachers had told me that she hadn't been feeling well and that she was still laying on her cot.
And what did Lindsay say or do after you told her that?
She came into the classroom and picked her up off the cot and said, "Oh, baby, come on, let's go get Dawson and we'll go home."
And so at that moment, when she came to the classroom, she hadn't already picked Dawson up?
No, she went upstairs to pick Dawson up.
And when she came into the classroom and told you that and picked up Cora, did you notice anything different about her than any of the other times you had interacted with her?
No.
In any of the time that you had interacted with Lindsay Clancy from September of 2022 to January 23rd of 2023, did you notice anything different about her?
No, she was just a very loving mother who cared about her children.
And did she share anything with you about her family or about anything that was going on in her household at that time?
No.
And you, as a preschool teacher, are a mandated reporter, correct?
Yes, I am.
So if you were to observe something either on the child or from what the child said or behavior of a parent, you would be required to report that?
Yes, I
And
would.
as far as the Clancy family went, you didn't notice anything and you didn't report anything, did you?
No.
Thank you.
All right. Mr. Reddington. Thank you very much. All right. Thank you, ma'am. Please step down. Thank you.
Mr. Reddington said, no, thank you. Mr. Reddington said, no, we're not crossing her.
Watch your step, please.
Okay.
Good morning.
Good morning.
All right.
She
Just
looks
speak
so
into that microphone.
scared.
Keep your voice up so all the jurors can hear you, okay?
Yes.
All right. Perfect. Ms. Sprague.
Thank you. Good morning. Can you please state and spell your name for the record?
Andrea Hennigan, ANDREA HENNIGAN.
And your date of birth?
March 11th, 1976.
What do you do for a living?
I'm a registered nurse.
And where do you work?
Massachusetts
she's a
General
nurse.
Hospital.
And do you work in any specific department there?
Labor and delivery.
How long have you been a labor and delivery nurse at Mass General?
25 years.
And as part of your training and work in labor and delivery, are you trained in recognizing or helping new mothers who seem to be having issues with postpartum?
Do you mean postpartum depression?
Yes.
I don't have formal training in that area, and I mostly see women before they give birth and immediately afterwards in the first 2 hours after they give birth. If they come back to the hospital during the postpartum period for a concern, we do screen patients for postpartum depression.
And is that all the nurses that work for the Mass General Hospital labor and delivery unit are able to do those great screenings for postpartum depression?
Yes, we ask patients questions about if they're suffering from depression or anxiety, and if they have any feelings of wanting to harm themselves or anyone else. That's a standard admission question.
And if these patients respond that, yes, they are having issues with depression, anxiety, or wanting to harm themselves or others, what do you do with those patients? Do you refer them somewhere, or do you give them materials? What do you do?
Well, we would talk more about their symptoms with them, and then the first step would probably to be alert the provider who's caring for them, either the doctor or the nurse midwife in our setting, and get social work involved.
Now, while you were working at Mass General Hospital, did you work with Lindsay Clancy?
Yes, I did.
How long did you work with her?
The whole time she worked on our unit, which I believe was 7 years.
And so when you say our unit, she also worked in labor and delivery with you, is that correct?
Yes.
And in addition to seeing her at work, would you also socialize with her occasionally outside of work?
Occasionally, yes.
Directing your attention to after Ms. Clancy gave birth to Callan, which May of 2022, so after May of 2022, did you reach out to her, talk to her in any way?
Yes, I saw Lindsay twice from when Callan was born until January. I saw her in June and in November, and we would send each other text messages.
When you saw her in June, where was that?
That was at her home. I brought some lunch for her and visited with her and the baby, and Patrick and Dawson were home.
And how was Lindsay's demeanor during that visit?
Very good.
Was she her typical self?
Yes.
And how long was that visit for, approximately?
Maybe 2 hours or something like that.
And you said the next time you saw her was in November of 2022, is that correct?
Correct.
And where was that?
It was a restaurant in Hingham. We met for lunch.
And when you met with her for lunch in November of 2022, did Ms. Clancy talk to you about some issues she was having with sleep and anxiety?
Yes, she did.
What did she tell you about that?
During the lunch specifically, I don't remember her exact symptoms. Our conversation surrounded her upcoming return to work, and Lindsay was feeling that she wasn't in a mental state ready to go and take care of patients. She talked about insomnia and some not feeling herself. I believe she might have used the words like brain fog or something like that.
And while you were having lunch with her and having this discussion, did you ever have any trouble understanding what she was saying?
No.
Did she ever appear to have difficulty understanding what you were saying in response?
No.
Was there anything different about her speech pattern?
Not that I recall.
When you were discussing these issues with Lindsay about having some insomnia and being concerned about going back to work, did you give her any advice or do anything to help?
Yes, it was myself and 2 other nurses that we work with who Lindsay was friends with outside of work, and we were all encouraging her to get the help and support that she needed with medication if needed and therapists, and giving her any ideas we could think of in our personal and professional lives that may help her.
And did Lindsay tell you that she was looking to find some type of medication that would help her sleep and help her with her anxiety?
Yes, I believe we talked about medication, and she was going to be meeting with a new therapist shortly.
And during this conversation or after it happened, did you ever have any concerns about her harming herself?
No.
Did you ever have any concerns about her harming the children?
No.
Did you give her some names of obstetrics or social workers?
I did. After our lunch, I recall that I reached out to another friend of mine who had had a pregnancy loss that was challenging for her and had met with obstetrical specific social workers and support groups. And I asked that woman, could you share those names? And I sent them to Lindsay.
Did you have some text messages between yourself and Lindsay around Thanksgiving of 2022 in which she told you about a program she was going to try?
We did have text messages around Thanksgiving. I believe the program you're referring to was something that her mother-in-law had told her about at South Shore Hospital that was more specific to perinatal issues rather than a general social worker, someone who specialized in this area.
What does perinatal mean?
During pregnancy, birth, and after birth.
So this was a program more focused on women either during their pregnancy, while birth, during birth, or right after birth, as far as you know?
I mean, as far as I understood it, I just understood it to mean someone who was familiar more with postpartum depression or anxiety, was my understanding.
Okay. And did you also receive some text messages from Lindsay Clancy right after New Year's on January 2nd, 2023?
Yes, I did.
And can you tell us what that exchange was?
Again, that was with myself and Lindsay and the 2 other nurses who she had confided in, and we asked her how her holidays were and could we get together again in the new year. And she said, I can't get together right now because I'm involved in an intensive program, but hopefully soon.
Okay. And did she wish you a happy new year?
She may have, I do not recall.
And did she tell you that she was in fact at that time at McLean Hospital, or did she just leave it more vague that it was just an intense program?
I believe it was an intense program. I did not know the name of the facility at that time.
Did you at that time know that she was currently at a hospital?
I don't recall what I knew then versus what I know now.
Did you also speak with Lindsay on January 23rd, 2023?
I did not speak to Lindsay. I sent her a text message on January 23rd.
And what did you say in your text message?
I'm paraphrasing, but I believe I said, "Hi, I've been thinking of you, wondering if you're still in the daily program," I believe I said. So maybe I didn't realize it was inpatient. And she responded.
And what was her response?
Again, I'm paraphrasing, but she said something like, "I'm no longer in the program. I'm continuing to work with my psychiatrists to find the right medication that will allow me to sleep at night but still function during the day. I've had a lot of bad or negative side effects from the medication, so I've had to come off of them and go on new ones, and it's been very difficult." Okay. Or has taken a long time or something like that.
Okay. And after those text messages that were exchanged on the 23rd, did you have any concerns that she was going to harm herself?
No.
The tone of the text messages, were they more positive and hopeful that things were going to work out on the right medications?
I don't know that they were more positive than previous times. I believe that Lindsay was always hopeful that she would get the care that she was seeking. So I don't know that the tone was different that day.
But it wasn't a negative tone. It was that same kind of hopeful tone.
Yes, as far as I remember.
Thank you.
Thank you.
Attorney Reddington.
Morning.
Good morning.
So even during the, say, the difficult times that she had, she was always trying to be hopeful and always tried to have a positive outlook on her health.
That was my impression, yes.
And you obviously are a good friend.
Yes, I believe so.
And you've known her for what, 7 years? 9 years now, right?
Yes, I believe since 2015, if that's when she began working at Mass General.
Right. So she was like a 24-year-old kid when she first started there, right?
Yes.
And you basically knew her right out of nursing school, all the way up through,
yes,
till she finally had the last baby, right?
Mm-hmm.
Can you tell us, what was her work ethic? Was she a good nurse? Was she a caring nurse? Tell us what your observations were. Granted that you're a friend and you might be biased, but tell us what you thought.
Yes. Lindsay loved being a nurse and was excellent at it. It was a second degree for her to go to nursing school. And you could tell with Lindsay, it was more of a calling that she really cared so deeply, specifically about caring for pregnant women and women giving birth. She was very attentive to all of her patients' needs. She was very smart. And mostly she was incredibly nurturing and caring.
Thank you. And during the period of time in the fall of 2022 up through Thanksgiving of 22 and then into 23, you obviously, as a good friend, stayed in close contact with her, texting, seeing her, dinner, lunches, and everything, right?
Yes.
And then when you and some of the other nurses would go to a lunch, for example, if I understand correctly, on one of the luncheons that you had in the fall of 22, she was telling or sharing with you the fact that she was going through a difficult period.
Yes.
Told you that she was not in a good mental state, that she had a lot of insomnia, and she even described it as brain fog, right?
Yes, I believe so. She definitely used those words in our text messages, as the fall progressed, but I believe she used those words during the lunch. She definitely said that she was in a difficult mental place and didn't think she'd be able to go back to work.
And she told you that she was actually actively treating with medical personnel? Did she say a psychiatrist, psychologist, or just seeing doctors, or what did she say?
Yes, she talked about therapists. She talked about going on medication. At some point in that month of November, she said she had even gone to the emergency department.
Did she tell you that she was having negative side effects with the medication that she had been prescribed by these doctors?
She did. She did not elaborate on the side effects, but she did say that multiple times.
So as close as you were for all those years working together, and you guys worked together through the COVID too, right?
Yes.
Is that a bonding experience for nurses?
Yes.
During that period of time, did you ever observe her? Was she a complainer? Like, would she come and complain to you, or was she pretty much private, but would share her opinions of what was happening inside of her with you?
She was not a complainer about work or home or anything, but we were friends, and she did share more personal details with me.
And when she was working, would you guys be working on the night shift, or would you work in the afternoon? Or
The night shift.
night shift.
Mhm.
So did you ever see her go on her phone and access cameras to see what was going on at home with the babies or anything like that?
Yes.
Is that something that she would do on a regular basis, staying in touch with the family and looking at the cameras?
Yes.
Did she ever tell you why she was doing that?
Not specifically.
Okay. She, to your appearance or to your observation, appeared to be very concerned about her kids, right?
Yes.
Did you ever hear her complain that she wanted to leave behind the life that she had and basically move on, something better?
Oh, no. Lindsay, from the time I met her as a young woman, very much desired to be a mother and have a family.
And she did share with you that her mother-in-law actually referred her to somebody for some help as well, correct?
Yes.
In the holiday period, you guys stayed in touch again. You were texting her, and that's when she was, now we know she was in McLean Hospital, but she told you she was in an intensive program, right?
Correct.
In other words, she didn't say, I can't go to lunch with you guys because I'm in a mental hospital. She basically said, I'm treating my problems.
Correct.
To your years of dealing with Lindsay and seeing her with her kids and her family, what's your opinion of her as a mother?
Lindsay was a very loving, caring mother. This is exactly what she wanted to have met. She wanted a big family. She was happy to have her children close in age.
Thank you.
Thank you.
Yeah, redirect?
No, Your Honor.
All right. Thank you, ma'am. You step
Thank
down.
you.
Okay. No redirect. Hey, Queen, how are you? Sorry, I didn't want to interrupt her. I try not to interrupt them, but, it's just... Sometimes I have to because, my mouth, I got things to say, so I try not to interrupt, but...
Watch your step, please.
All right, who we got here?
All right. Good morning.
Good morning.
Counsel?
Thank you. Can you please state and spell your name for the record?
Bethany DeColibus, BETHANY DECOLLIBUS.
And your date of birth?
6/29/89.
What do you do for work?
I'm a licensed marriage and family therapist.
And do you have your own practice?
I do have a private practice.
How long have you been in this line of work?
I've had the private practice for about 6 years, but I've been licensed for close to 12.
And in your practice, do you do in-person therapy or telehealth therapy?
I do telehealth therapy right now.
Do you know Lindsay Clancy?
I do.
How do you know her?
We were friends, met as new moms in the same town.
Would that be Duxbury?
Yes.
And how often would you see her?
I'd say probably weekly.
And where would that occur?
Our kids were involved in similar activities, music classes, gymnastics classes. We'd schedule play dates.
What was her typical demeanor?
She was active, engaged, friendly.
Did you ever notice any distinctive changes in her rate of speech or the way she spoke?
No.
Did you ever see any extreme changes in energy or weird behavior?
No changes in weird behavior, but I did notice that she appeared more tired.
I'm sorry to do that.
Could you repeat that?
You could state that again.
Oh, I was answering the second part of your question. I didn't notice any changes in behavior, but I did notice her appearing more tired over time.
And was that after she had Callan or before that?
Afterwards.
And how often would you see her after she had Callan?
Weekly.
So still going to the same types of places where you would run into her and engage with her. Is that correct?
Yes.
And other than seeming more tired, was there any other change in her demeanor or personality or behavior?
No.
Did she tell you during that time that she was having trouble sleeping?
Yes.
And did she give you any specifics on that?
Just that it was very difficult to get sleep, difficult to fall asleep even when kids were asleep, and that it was an ongoing struggle.
Did that cause concern for you at that point?
I think for a period of time, it felt normal, but after it seemed to continue and not let up for her, I definitely worried about her and was concerned.
When you say it seemed normal, what do you mean by that at first?
I would say for a period of time seemed reminiscent of, sleep troubles that, I remember having and that, remember friends talking about. But I think over time, I started to worry more and realize that it wasn't improving for her.
And what you're talking about, is it, typically after having a baby, new moms are tired from, late night feedings and changings and all of that.
Yes.
And then with Lindsay, she stayed tired.
Yes.
Okay. Did she talk to you about seeking out help from doctors?
She did.
And did she talk to you about seeking out medication to help?
Yes.
And do you recall any specifics about those conversations, about what types of doctors or what types of medication she was seeking?
I don't know about the different types of doctors or the types of medications.
Did you ever talk to her and she relayed that she was looking to find a therapist?
Yes.
And do you know if she ever found a therapist?
At some point, it did sound like she had found a provider to work with.
Being a therapist yourself, did you ever offer to give some referrals or anything like that? Or did she ask for any?
I can't remember.
And you said that she continued to appear tired, correct?
Yes.
But other than appearing tired, as the weeks went by, did you observe her and having any problem interacting with people or doing the typical behaviors that you would do at the events you would usually see her at?
No.
Did she appear to have any trouble doing day-to-day tasks or interacting with anyone?
Not that I saw.
Did she ever tell you that she was depressed or suicidal?
No.
Did she ever tell you that she had thoughts of harming anyone else?
No.
Did her physical appearance change in any way?
Not that I noticed.
When you would engage with her, have conversations with her, were they usually in person or text or both?
It was a mix of both.
And did you ever have trouble understanding her, either in person or in a text?
No.
Did she ever appear to have trouble understanding you?
No.
At some point in time, did you have dinner with Lindsay and a woman named Erin Renault sometime in November?
Yes.
And was that something that the three of you typically did?
Yes.
How often would you do that?
Probably once every couple of months.
Was this the first time you'd done that since Callan was born?
I can't remember.
Okay. And what was Lindsay's demeanor during that dinner?
She was engaged in conversation with us.
Do you recall saying previously that she seemed normal?
No.
You don't recall saying that?
Not specifically, no.
What about her speech pattern? Was there anything different about her speech pattern?
No.
What did you guys talk about during that dinner?
I remember catching up as we usually did, giving each other updates on, what our kids had been up to, what our families had been up to. And I also made it a point to check in with her about how her sleep was and how she had been feeling lately.
And did she give you responses to those questions?
She did.
Did they make sense?
The responses made sense.
Yeah. What was the tone of this conversation?
I'm not sure how to answer that question.
Well, when you're asking her about how things are going with her sleep and other things, and she's responding, Does she seem negative and depressed about things? Does she seem hopeful about things? Like what's the tone?
I mean, it was a serious conversation. I was concerned and wanted to check in. It had sounded like she had been able to connect with some providers. And I would say at that point, I remember her expressing feeling hopeful about the possibility that things could start to get better.
And during this conversation at dinner, did she ever mention that she had suicidal thoughts?
No.
Did she ever mention that she had homicidal thoughts?
No.
Did she ever tell you that she was hearing voices?
No.
Did she ever tell you that she was having intrusive thoughts of her own?
No.
At any point in time while you're engaging with her, did it look like she was responding to something internally, like a voice, or seeing something that wasn't there?
No.
Other than having an issue with sleep, did she mention any other issues that she was having?
She mentioned feeling anxious.
And after this dinner, did you next see her at Cora's birthday party in January?
Yes.
And at that birthday party, did you see her interacting with other people and parents and children, as a mom would usually do at a birthday party?
Yes.
Did you interact with her yourself?
I did.
Did you notice anything different about her demeanor or her behavior at that party?
No.
Did you have a conversation with her briefly about sleep?
I did.
And was it you basically asking how the sleep issue was going?
Yes.
And what was her response?
She responded that things haven't gotten any better and that she feels like a zombie.
Was there anything about her appearance or the way she was interacting or behaving that when you saw her, you thought she looks like a zombie?
She seemed tired.
But there's a difference between being tired and looking like a zombie, right?
She didn't look like a zombie, no.
And she was able to engage with you and the other parents there, engage with her children and the other children, correct?
She was.
And do you recall stating previously that at the party she seemed fine?
And no, not specifically.
Page 11. Have you look at page 11 and bottom line 24, and then to the top of page 12. Does that refresh your memory as to a conversation you had with the police back in 2023 where you said that she seemed fine at the party?
Sure, yeah.
I have no other questions. Thank you.
Reddington.
So,
Okay. Reddington's going to cross. Hey, Earth. Sorry. No, I didn't want to interrupt her. I really hate interrupting. I try not to interrupt, but, sometimes my smart mouth gets the best of me when they're talking. So we're going to change to cross. This has been an interesting one because they were obviously friends also.
Morning. Fair to say that you were obviously pretty good friends with Lindsay?
Yes.
And fair to say that in that regard, you had occasion to observe objectively things like she looked tired, she was complaining that she was tired.
Yes.
Said that she was anxious.
Yes.
Told you that at one point towards the end time frame into January that she felt like a zombie. Correct?
Yes.
Did you ask her any questions like the district attorney was asking you? Did you ask her, well, what are your symptoms and what do you feel like? And what do you, is there anything that you can tell me about how you feel? Did you probe in that regard?
I don't remember probing about specific symptoms, no.
So in other words, you're friends and you and Erin and Lindsay were out to dinner or lunch and you're trying to have a good time, right?
Yes.
How was she as a mother to your observations? Did she, as far as taking care of her kids, being happy with the kids? Did she not like her kids? What were your observations?
She loved her kids. She was warm, kind, consistent, loving.
And You actually were summoned to be here today by the district attorney's office, correct?
I was.
And you actually were interviewed by the state police. That's what she was questioning you about, page 11 and page 12. It was a recorded interview and things of that nature, right?
Yes.
Would you agree with me that although she may not have been telling you that she was seeing something that wasn't there, or hearing voices or drooling or acting in some unusual fashion while you guys were out having lunch, she did express to you that she was having some difficulties, correct?
She expressed that she was having difficulty, yes.
And would you say, knowing Lindsay as you did, that she was a type that was not really a complainer? She would not try to be a downer when you're out to lunch and having a good time with your friends and complain about her symptoms?
No.
But she did tell you that she was somewhat hopeful because she was seeing healthcare providers.
Yes.
And one of the things that they had asked you about, fair to say that when you talked to the police, you told them that you had spent a lot of time chatting about over this period of time that she had been having a lot of trouble sleeping, and that she referenced the postpartum period, right?
Yes.
And when you were talking to the police, the troopers, did they try to divert you? Did you feel that they were trying to get what your observations were, or did they want you to focus on their questions when they were questioning you?
Could you repeat that?
No, it's a bad question. Never mind.
Sorry.
It's a bad question. I'm sorry. But nevertheless, you actually told them that you had
No,
been in
not
touch with her, you'd been
nevertheless.
to the house, right?
I had been in touch with her, yes.
Yeah, and you knew Patrick.
Yes.
Other than socializing with your friends and with Erin and going out to lunches, you guys would also text, correct?
Yes.
And that's a way of keeping touch with each other.
Yes.
And she would respond to your inquiries about fun things and about kids, right?
Yes.
But also, on occasion, you were concerned about her and you'd ask her how she's doing, right?
Yes.
And when you would ask her those things, she would tell you, for example, that she didn't know what medications were doing to her, but she in fact mentioned to you that the medications did not appear as though they were helping, and she still wasn't able to get any sleep.
Correct.
And further, in the statements that you gave to the police when they were asking you questions about your observations, she did indicate on a couple of occasions that she had obtained a therapist and a prescriber. And she would reference her relationship with Pat and tell you that Pat's great, things like that, right?
Yes.
You said yes. I'm sorry, the door
Yes.
closed. So in those occasions, did she ever complain about Pat, or would they seem to be getting along pretty good?
They seem to be getting along great.
Was he supportive to your observations of her?
Yes.
Then when you went out to the other dinner, did you indicate to the police that in that conversation that her mother knows everything, or she told you my mom knows everything, and she's working it out as far as the therapist and the drugs, correct?
Yes.
And you still felt that it was readily apparent that she was struggling, right?
Yes.
Still having difficulty sleeping and being anxious, right?
Yes.
And as a friend, you were concerned, right?
I was concerned, yes.
Now, one of the questions the DA had asked you is that she was supposed to go back to work, and that she indicated that she had canceled that date to go back to work because she still wasn't sleeping well. Is that right?
She had, yes.
And those were her words, that she canceled going back to work because she still wasn't sleeping well.
Yes.
Did she ever talk to you about work? Did she seem to like her job as a labor and delivery nurse?
She loved it, as far as I knew.
And then you were at Cora's birthday party in January, is that correct?
Yes.
And that was the one that was at the trampoline park, right?
Yes.
And it was that time, and that would have been in January of 23, I believe, that it was in that time that you were concerned and you said, hey, are you getting any sleep? And she was like, no, I feel like a zombie, is what her words were, correct?
Yes.
Is that the last time you saw her?
Yes.
Thank you.
Can you redirect?
No, Your Honor.
All right, thank you, ma'am. Let me step down. Counsel, why don't we take a brief recess at this time? So we're going to take the morning recess at this point.
Okay, morning recess. So, with that, again, welcome to Rubber Ramada Reviews. This is the point where we get the luxury of Zoom, and we don't watch all that. We skip the fluff. We hang out. We chat. We keep it real. But we don't deal with breaks. Again, we take those 8-hour days, and we bump it into usually 4. And thank you for being here and hanging out. If you're on the replay crew, be sure to hit the thumbs up. It's always greatly appreciated.
Defendant and thank you.
The luxury of Zoom, we have our next person on the stand.
All right, good afternoon. I'd ask you to speak into that microphone, keep your voice up if you could, okay? Okay. All right. Tree spray.
Good afternoon. Good afternoon. Can you please state and spell your name for the record?
Amy Bevins, AMYBEVINS.
And your date of birth?
8/22/90.
Do you live in Connecticut?
Yes.
What do you do for work?
I'm a licensed behavior analyst, but I specialize primarily
And welcome in, Cindy. I seen you pop in. Sorry.
in early intervention for young children with autism.
You could just keep your voice up a little bit, maybe come a little forward to the mic. How long have you been doing that?
6 years. I was a special education teacher before that for a long time as well.
Do you know Lindsay Clancy?
Yes.
How do you know her?
We have been friends for almost 29 years.
So you met her when you were children?
Yes.
Did you go to school together?
Elementary school.
And after that?
All the way up through middle school and high school as well.
Okay. And did you keep in touch with Lindsay when you went off to college?
Yes.
I'm assuming you didn't go to the same college, right?
No.
Do you know where Lindsay went?
Quinnipiac University.
And how did you keep in touch?
Through texts, phone calls. We visited each other at each other's campuses.
Okay, one, I love that black top. I love that black top. The scalloped edges, love it. 2, this might become a little emotional. As y'all know, we watch these blindly, so I have not seen this part. I do listen to some of the morning part, but we are now in the afternoon. I know nothing that's going to happen. So we are adults here. This may get emotional. I'm not sure. Thank you for being here.
And then when Lindsay went to nursing school, did you still stay in touch at that point in time?
Yes.
And how did you do that? The same way, like text visits?
Yes. I also lived in Boston at the same time that she was in nursing school up in Boston.
So was your contact more frequent while she was in nursing school versus when she was in college?
I can't remember the exact amount of contact, but I would say we were always in contact together, yes.
Okay. While Ms. Clancy was in nursing school, did she ever tell you that she was taking some mental health medication?
I can't recall.
Did she ever tell you that she was struggling with anxiety or anything like that while in nursing school?
Nothing that I can recall.
And after she was finished with nursing school, did the two of you still remain in touch?
Yes.
And how often would you see her?
I moved back home to Connecticut, so whenever she was able to visit home, we would stay in touch. I traveled to Boston, not very frequently, but I would visit her there as well.
And did you have a text chain going between the two of you?
Yes.
And did you also have a group text with other friends from Connecticut that you both grew up with that you would participate in?
Yes.
And how often would you text with Lindsay?
Pretty frequently. It depended on, I think, the point in life that we were at, but I would say there was regular communication.
And growing up with Lindsay and knowing her into adulthood, how would you describe her general demeanor?
She was pretty a calm person. She was nice and had a very calm approach to herself.
And during that time that you knew her and would interact with her, did you ever notice any changes in her pattern of speech or rate of speech?
No.
Was she pretty consistent in her behavior and speech patterns throughout the years that you knew her?
Yes.
After Ms. Clancy had Cora, were you still in contact with her at that time?
Yes.
And just to kind of get it out of the way, were you in contact with her all the way up through January of 2023?
Yes.
And so after she had Cora, did you notice any changes in her demeanor?
No.
Did you notice any changes in her behavior?
No.
Did you notice any changes in her speech patterns?
No.
After she had Dawson, did she talk to you about that delivery and how that went?
Yes.
And what did she tell you about that?
That was more of a difficult delivery than the one she had with Cora, that she would maybe need to take some time to recover prior to thinking about having a third child.
And during that time, after she had Dawson, did you notice any changes in her behavior?
No.
Or her demeanor?
No.
Her speech pattern?
No.
Was there anything about your interactions with Lindsay during that time that caused you to have concern about her harming herself or someone else?
No.
And then after she gave birth to Callan, did you notice a change in her demeanor at that time?
No.
Or her behavior or rate of speech?
No.
Did you see her in Connecticut in November of 2022?
Yes.
And why did you see her then? What was happening?
She had traveled down to Connecticut. We had gotten together as a group to go out to breakfast.
And had she come to Connecticut alone or with her family?
Alone, I believe, at that time.
And you said you went out to breakfast?
Yes.
Was this with that whole group of friends and spouses and everyone that kept in contact from Connecticut?
Yes, there was a group of us there that had all remained friends.
Did you notice anything about her demeanor or behavior at that breakfast in November of 2022 that caused you concern or was different than her typical behavior?
No.
Did you have some text conversations in January of 2023 about some issues that Lindsay was having?
Yes.
And do you recall when those messages started?
I don't recall the exact date of the messages, but it was only, I believe, one night.
And in terms of what happened on January 24th, 2023, how close in time was it to that?
Can you repeat the question?
So in terms of January 24th, 2023, when the children were killed, how close in time were your text messages to that incident?
Only a few days.
Okay. And what was that text conversation?
She had shared that she had been taking a medication that caused her to have some dark thoughts, but that she was going to, or had been tapering off that medication and was trialing new ones that would remove those side effects and be more helpful and therapeutic to what she needed.
And did she tell you what those dark thoughts were?
No.
What was the tone of the conversation?
Hopeful, I would categorize it. I remember it being something where there was conveying of hope and that it was going to be we were moving in a positive direction.
We'll be in recess, so basically, parties can kind of get them.
Their day is over, but we were still talking. Bring me back to the lady that was talking, damn it.
Had been taking a medication that caused her to have some dark thoughts, but that she was pretty a calm person.
Were killed. How close in time were your text messages to that incident?
Only a few days.
Okay. I'm just going to let it play from there. Sorry, the day ended. It skipped forward. Y'all, that happens almost every day. I try to prevent that, but I didn't catch it.
Okay. And what was that text conversation?
She had shared that she had been taking a medication that caused her to have some dark thoughts, but that she was going to, or had been tapering off that medication and was trialing new ones that would remove those side effects and be more helpful and therapeutic to what she needed.
And did she tell you what those dark thoughts were?
No.
What was the tone of the conversation?
Hopeful, I would categorize it. I remember it being something where there was conveying of hope and that it was going to be we were moving in a positive direction.
So basically, would it be fair to say that Lindsay was telling you that she'd had some side effects and some dark thoughts because of medication, but was weaning off of those and moving on to something else that would hopefully help her?
Yes.
Did she ever express at any point that she wanted to harm herself?
No.
Did she ever express that she wanted to harm the children?
No.
Did she ever tell you that she was hearing voices?
No.
Other than saying that she had had some bad thoughts, did she say anything else that was concerning in that conversation?
No.
I want to direct your attention to March of 2023. Did you visit Miss Clancy while she was at the Spalding Rehabilitation Facility?
Yes.
And how was that arranged?
At the request of one of her family members who reached out to see if I would like to come visit.
And you traveled to Massachusetts and visited Lindsay at the Spalding Rehab Center, is that right?
Yes.
And what did you do there with Lindsay that day?
We made small talk. We played Uno. It was a pretty basic visit.
When you say you made small talk, what did she talk about?
I remember her asking about my daughter. I remember her asking about any updates to life events for our friends. We talked about some hobbies that she was doing while at Spalding and then played a game.
Do you remember what hobbies she was doing at Spalding?
I can't recall specifically now.
At any point in time, did she mention the death of her children?
No.
At any point in time, did she break down in tears and cry about her children?
No.
What was her affect during that meeting?
I don't remember exactly. Pretty neutral, I would say.
Did she attempt at any point to harm herself?
No.
Did she ask you for help in harming herself?
No.
Did she talk about Cora, Dawson, or Callan at all?
No.
And nothing further, thank you.
Mr. Reddington.
Afternoon.
I hope he's I'm sorry, I got choked on a popcorn whole thing. So I turned my camera. Hopefully he's gentle with her and he doesn't like cause any friction because we know he can be a little off with his words. Please be kind, sir. Mr. Reddington, be real gentle. This is for your client.
Nervous. Don't be. Okay. You guys go back how far?
Almost 29 years.
And over those 29 years, knowing Lindsay when you guys were in grammar school, I guess, and high school, and then you went off to college and you had your families and your marriages, tell us what your opinion was of her as a person.
I knew her as a good person, a good friend, a good mom.
And you had occasion to see her with her kids and how she acted with her kids, Cora, up till Callan.
Yes.
And did you ever observe anything out of the ordinary, or did she appear to be a loving person and taking care of her kids?
I never saw anything out of the ordinary.
District Attorney asked you about the visit that you had when you were good enough to visit with her at Spalding Rehab. And this was when, in March of 23?
Yes.
And arrangements had to be made for you to visit with her. You had to get approval, and whether you know or not, I mean, I had to kind of help you out a little bit trying to get through the red tape to get in there to see her, along with her family approval and that type of thing, right?
I don't recall any of that.
But you were able to get in?
Yes.
To visit with her. And this would have been in the beginning of March, if you know, the middle of March, the end?
I don't recall the exact time.
Was she able to walk around and ambulate, or was she in a wheelchair, or what was her condition? Was she in bed?
She was in a wheelchair. She was sitting up the entire visit.
Did you ask her about why she was in the wheelchair and anything like that?
No.
You knew that she had been in the hospital from January 24th, right?
Yes.
And you knew that your friend had been charged by the police and had killed her 3 beautiful children, right?
Yes.
That was a bit of an awkward, uncomfortable topic, wasn't it?
I think it would be for anybody, yes.
Absolutely. And the district attorney asked you whether or not she cried and whether or not she told you about her children and anything to do with her children or that incident. You both basically stayed away from that entire subject, right?
I remember also being told not to bring that up specifically, which at the time I figured that could be due to the recommendation of mental health providers, et cetera, who were treating her.
Right. And who told you that?
Her sister.
Now, how long did you visit with her?
Oh.
It was brief, maybe.
Okay, wait. I'm sorry, I'm interrupting. Her sister told her when you go visit her, don't talk to her about anything too personal of the incident. Teresa, I'm y'all know I try not to interrupt these people, but I'm just
30 to 45 minutes.
That's all I have. Wait a minute. Did you guys have a group
you
get
can't
together
say
in December of 2022, if you recall?
that's all I have. And then he continues with another question. Reddington,
That's all
please.
I have. Wait a minute. Did you guys have a group get together in December of 2022, if you recall?
I don't recall.
Do you recall seeing her after Thanksgiving around that time frame in December of 22?
I don't recall no.
Do you recall having conversations with her around that time frame, which would be in December of 2022, that she was talking to you about medications and asking you questions about a particular medication?
I don't recall the exact time frame of those conversations.
Okay. You were summoned here today by the DA's office, is that correct?
Yes.
You were also on my witness list as well, right?
Yes.
And when I ask you about the conversations, the reason is you were questioned by the state police back in January of 23. Do you remember that?
Yes.
And one of the troopers had asked you whether or not you had any conversations with Lindsay, your friend, about medications. And you indicated that, and I quote, page 12, she knows that I'm pretty open about mental health, that I'm a big advocate of mental health. And she asked me if I knew, like, if I had tried a medication. Do you remember saying that?
Yes.
Okay. Does that refresh your memory at all as to approximately what time, when that was? Would that have been in December of 22, after Thanksgiving?
I don't know. I still don't recall the exact time, but I do remember that being a conversation that we had.
Okay. Do you remember where you had the conversation?
It was over text message.
Okay. Do you recall her asking you what your experience was? Because you had some knowledge of medications, correct?
As a patient.
Okay. And as a result of that and being close and good friends, that she had asked you what your experience was. And again, it's page 13. And she would say, how was your experience? Did you ever take this? What was your experience with this? That type of thing. Do you remember that? That conversation?
I don't recall the specific conversation.
Do you recall the medication that she asked you about?
Yes.
What was that?
I remember it being Lexapro.
Do you recall in your text message exchange that she had asked you about or told you about some of the medications that she was taking and that there were some difficulties with it?
Yes.
Do you remember that she had asked you whether or not you had noted or if you were aware of any side effects of medications?
I don't recall.
And after those text threads and with that understanding, being as close to Lindsay as you were, she then confided in you that she was having dark thoughts, as I think was the expression.
That was a long time after the conversation that we had had about the medication. I do remember that being the first time I had heard any concern around her mental health up until that point.
Okay, and what point was that, if you remember?
Can you restate the question?
Sure. Let me ask it this way. When she told you that she was having problems or difficulties with the medication, and was telling you that she was having dark thoughts. Do you remember when that was?
Towards the end of January 2023.
Okay. Do you remember, was that in person or was that a message, text message?
Over text message.
Why are we not
Did
pulling
she
out these text
explicate it? Did
messages?
she explain what the dark thoughts were?
No.
And the next time you saw her after?
Let me interrupt. Let me interrupt. If we have all this in text messages, why are we not pulling out text messages? I mean, I know we want to speed this trial along, but, you know, if facts are facts and was just.
That was at the hospital rehab, correct?
Yes.
Thank you, ma'am. That's all I have.
Counsel? All right, thank you, ma'am. May step down.
No, 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 no. Yeah, and pretending that everything is fine, pretending everything is fine is a wrong approach. You as a friend, oh my God, y'all. Oh.
Good afternoon, sir. Can you stop right there, raise your right hand for the clerk, please?
Good afternoon. Do you solemnly swear that the testimony in the evidence you will give to
Is this my water?
He says, "Is this
Good
my
afternoon,
water?"
Good
Sorry,
afternoon.
I gotta calm down a minute. That just
Thank you. Good afternoon. Can you please state and spell your name for the record?
Say that again, I'm sorry.
Could you please state and spell your name for the record?
Yes, Christopher William Clancy, CHRISTOPHERWCLANCY.
And what's your date?
I knew he came to the stand, but I have no clue about his testimony. So we're going in this blind, guys. I will try to keep my commenting to a minimum.
Date of birth?
7/26/61,
Where do you live?
Situate, Mass.
And do you work?
No, I'm retired.
What did you do before you retired?
I was a plumbing contractor.
Is Patrick Clancy your son?
Yes.
When did you first meet Lindsay Clancy?
I don't know what the year was, but I believe I met her for the first time at my at the cottage in Hull. That was my parents' house, and I believe that's when I met her. I think he brought it down there.
Was that before or after she and Patrick had gotten engaged?
That was before.
And eventually they got engaged and got married, correct?
Correct.
And had 3 children, correct?
Correct.
So I
Trying to
want
see
to
what
direct
it
your
was.
attention to the time frame after Callan was born in May of 2022. Did you have a chance to observe Lindsay interact with Callan?
Yes.
And what was Lindsay like with Callan?
She was very mothering.
And was she protective?
I would say yes, like any mother would be.
Do you recall describing her previously as very protective of him?
I would say that she was very protective of him.
Was she, in terms of how protective she was of Callan versus Dawson and Cora, was she more, less, or the same?
I would say she was more of the same when the babies were little, when the babies were young.
So was that something typical when she would have one of the children to be very protective when they were first born?
Yes, I think that's like any other mother, though.
And how often would you see the family?
We saw them regularly. They lived not too far from us. They lived in Weymouth first, and we saw them regularly.
And then eventually they moved to Duxbury?
Yes.
And directing your attention to the time frame between November 16th, 2022 and Thanksgiving of that year, did you see them at your house?
I think they did come up to our house one time. Might have been a Saturday or Sunday.
Okay. And why did they come over that day?
I think they just came over to say hi.
And what was Lindsay's demeanor that day?
Very good.
And was there any difference in her behavior or speech pattern than what you've seen with her previously?
Not that day.
And how was that visit?
Very good.
Did you then see them at or around Thanksgiving?
Yes, we did.
And where was that?
That was at my daughter Laura's house in Hamilton.
I'm sorry, I didn't mean
In
to.
Hamilton.
And did you interact with Lindsay that day?
Yes.
What was her demeanor that day?
She seemed a little, how do you say it? Let me think for a minute. She seemed quiet.
Okay. And did she seem to interact with everyone there as she normally would?
Yeah, she was very close with my daughters and her sister-in-law.
Do you recall them wearing coordinating shirts that day?
I think so.
And during dinner that day, did you make observations of Lindsay getting the kids settled down for dinner?
I did.
And did you see her interact with Dawson?
Yes, I did.
And can you describe that interaction, please?
Mm-hmm. She was getting a little frustrated. Dawson was being a little silly, and she was trying to get him to sit down. And she was just a little bit getting frustrated with him, and I noticed it. So I got up to help her.
And when you saw her getting frustrated with him, did you see her do something to get him seated?
She took him by the arm and to get him seated. It wasn't anything crazy.
Right.
You know.
It's not like she hit him or anything like that.
No.
Right? She just took his arm and guided him to the seat. Is that correct?
Correct.
But you could see that she was frustrated.
I could.
And so you stepped in to help her, right?
Correct.
And what did you do to help?
I got her a plate, I believe. There were a lot of people, so it was just a little chaotic.
Now, directing your attention to the weekend before Christmas 2022, did you stop by their home that weekend?
I believe we did, yeah.
And who was there?
Her parents.
So it'd be Lindsay's parents, Lindsay, Patrick, and the kids?
Yes.
And were you by yourself or with your wife?
I was with my wife.
And was there a specific point for everyone stopping by and gathering that day?
I don't recall that.
Okay. Were you and your wife checking in or helping out that day?
We might have just been going down to check on things.
Okay. Did you know that there were some struggles going on at that point?
I did.
And did you know that Lindsay was, specifically Lindsay was having some struggles at that point?
Yes.
Did you stop by again a few nights before Christmas?
I thought that's the night you were talking about. Yes, I guess we did.
Okay. And when you stopped by the night before Christmas, do you recall who was there that day?
I think the same people, but I'm not positive.
So Lindsay's parents, Lindsay, Patrick, and the kids?
Yes.
And what was Lindsay's demeanor that day?
It was okay. It wasn't terrible.
Do you recall testifying previously and saying that she seemed like she was in good spirits?
Yes.
Would that be accurate?
Yes.
And when you were there at the house that day, did you make plans for the following day for Christmas Day?
Yes, we made plans to go to Mass.
And who was going to go to Mass?
Lindsay, Patrick, the kids, my wife Sue, and me.
And did you all, we'll strike that, the following day on Christmas, did you go over to Lindsay's home before going to Mass?
Yes.
Okay. Did you all gather for breakfast?
I don't recall.
And let me approach. Page 33. If you can just read to yourself lines 2 through 7, and then just look up what you're done.
Okay.
Take your time.
All right.
Does that refresh your memory, sir?
Yes.
So did you go over that day for breakfast?
Yes.
And how was Lindsay's demeanor that day?
It was good. She looked beautiful. She had a beautiful dress on.
And do you recall saying previously she seemed very happy that day?
Yes, she did.
And after breakfast, did everyone go to church as planned?
Yes.
And how were the children in church?
Fantastic.
Very well behaved.
Very well.
And then after church, did you have a conversation with Lindsay outside of the church?
I think we talked a little bit. I don't remember what we said, but we were going our separate ways.
Do you recall saying previously that Lindsay said she was glad she came and she really loved it?
Yes.
What was her demeanor while she was engaging with you after Mass?
She was quiet. She said that she liked the Mass and she was really happy that she went.
And do you recall saying before that, strike that, do you recall after that conversation, you guys hugged each other and went your separate ways?
Yes.
Did you see the family again after Christmas?
I'm not sure.
What?
I'm not sure.
Did you?
That is an odd question to say I'm not sure to. And I'm going to tell you my opinion on that because just as a general thought that ran from this side of my brain through this side and went way across the room was if you saw your grandkids Christmas Eve and then you didn't see them again and you find out you would know if you've seen them again before they passed away. That I don't know why that squirreled me,
You
but
go to Cora's birthday party?
No,
Was it more of a kids gathering at a trampoline place?
that's what I heard.
Okay.
Yeah.
All right. Did you have plans to see them Tuesday, January 24th, 2023?
No.
Do you recall saying previously that there were plans to get together for dinner that night,
Hey,
but they
Pack
changed
Walker.
because your wife had plans with her brother?
No, we never had plans to go there Tuesday night. They asked us to come to the Tuesday night, but we already had plans with Sue's sister Joan.
Okay, so there weren't set plans, but you were asked to come to their house that night.
Yeah.
Okay. And then you couldn't go because you had other plans.
Right. We were going to make it for Friday.
Thank you for clarifying that. In terms of your interaction with Lindsay and Patrick and the kids, while there were some struggles going on, did you and your wife offer to take the kids to your house overnight to kind of give them a break?
I did mention that to my son.
And was that offer declined?
Yes.
And going back to Thanksgiving of 2022, when you were interacting with Lindsay, I think you previously said that her demeanor was good. She was quiet. Did you also say at one point she had a little blankness to her at times?
She seemed to at times.
And can you tell us like what that was?
Just like a stare.
Kind of staring off into the distance, distracted?
No, just not totally interacting. Just sort of.
Okay. So at some points.
Almost like nervous, kind of like.
Nerves.
Almost just like, something like that.
Okay, so at some points she was staring a little bit, seemed a little nervous, but then in other times she was interacting with everyone as she normally would?
Pretty much.
Okay. You mentioned earlier when you were talking about Lindsay having a little bit of difficulty getting Dawson seated at Thanksgiving that he was being a little silly.
Yeah.
Was that typical for him to behave in that way?
Yeah, he was a handful, but he was good. He was a good boy.
Going back to the night of January 24th, 2023, at some point in time that night, did you get a phone call from Patrick?
In January?
January 24th, 2023.
Yes.
Go ahead.
Yes, we did.
And what was his demeanor during that call?
Is this the night of the?
Yes.
Okay.
Yes.
It was terrible.
And did you and your wife leave your home and head to the hospital to be with him?
Yes.
Thank you.
Attorney Reddington.
Thank you.
You seemed a bit kind of off and confused about some of those answers and stuff. That was a little odd. Okay, Mr. Reddington. Oh, Mr. Reddington, please be kind.
Good afternoon.
Good afternoon.
Mr. Clancy, just a couple of questions. You were summoned to be here by the DA, is that correct?
Correct.
And you gave statements to whoever wanted statements. You were very cooperative with the investigation, is that right?
Yes.
And being as you're obviously grandfather and father of Pat, over the years from the time they were dating, engaged, married, kids, you and your wife were pretty close with both of them, were you not?
Yes.
Do you have an opinion as to how Lindsay was as a mother that you could see?
She was very, very good. She fed them great. She did a lot of things with them. They did like the all-American family.
And district attorney had asked you about Thanksgiving of 22, November 16th of 22. And she made reference, I think you had responded that she appeared to be quiet. And then she used the term, did you know about the struggles? Can you tell me what the struggles were? Do you know what she meant by that?
I knew.
Go to sidebar.
Sure.
Oh. She says, no, we're not going to discuss that. Let's go to sidebar, please. We're not supposed to talk about them struggles, guys. Mental health is a bitch. It's taboo. We don't talk about it. Struggles? What struggles? Okay, so evidently they dismissed the jury and they took a break. Okay, y'all do the damn thing. They said, we ain't talking about all her struggles. What the heck? Oh no, and they didn't even bring him back. What the hell?
Sure. Hi, good afternoon, sir.
Wow. Okay. Brought a new guy to the stand and
Your name for the record.
hold the hell up. Well, I appreciate you so much, Censored Sergeant, but I don't know what the fuck you're talking about. Have a great day.
Kyle Carney, KYLECARNEY,
And your date of birth, please.
July 6, 1991.
And what town do you live in?
Duxbury.
What do you do for work?
Work in finance.
And are you married?
Yes.
Who's your wife?
Sarah Carney.
And you have children?
Yes.
Does your family, or did your family know the Clancy family?
Yes.
And did you know them through your friendship with Patrick Clancy?
Yes.
When did you meet Patrick Clancy?
2009.
And how did you meet?
We went to college together.
And after going through college together, did you remain friends after school?
Yes.
And eventually, did you end up living in Duxbury at the same time Patrick and his family lived in Duxbury?
Yes.
When did you meet Lindsay Clancy?
Maybe 12 years ago.
Did you meet them before they were married? Did you meet Lindsay before she married Patrick?
Yes.
Okay. And then obviously you knew them after they got married and as they had their children.
Yes.
How often would you see Patrick and his family while you were both living in Duxbury?
Maybe every other month.
And would you interact with Lindsay Clancy during those gatherings?
Yes.
And what was her typical demeanor?
Kind, caring.
Did you ever see any changes, significant changes in her behavior or demeanor when you would interact with her?
No.
Did you notice any
Don't call him a
changes
struggle,
in
though.
Lindsay Clancy after the birth of Cora or Dawson?
No.
Directing your attention to after Callan Clancy was born, did you interact with the Clancy family that summer?
Yes.
And how so?
Maybe beach dinners. It's hard to recall exactly.
So you said beach dinners, is that what you said?
Yes.
So basically families gathering together at the beach, having dinner, interacting with each other, is that right?
Sure.
How often would you do that during the summer of 2022?
I couldn't tell you exactly.
More than once?
Yeah, like at least monthly.
Okay. Did you also go fishing with Patrick during that time?
Yes.
Over the summer of 2022, did you notice any differences in in Lindsay Clancy's demeanor or behavior?
No.
Throughout the fall of 2022 into the beginning of January 2023, would you see Patrick Clancy?
Yes.
How often did you see him?
Again, maybe once a month, maybe.
And directing your attention to Sunday, January 22nd, 2023, did you have a small gathering at your home?
Yes, their family came over to my house.
And when you say their family, are you talking about Patrick Clancy and Lindsay Clancy?
And Cora and Dawson, too.
Callan didn't join them?
No.
Was he home with Lindsay's parents?
Yes.
And what was the purpose of gathering that day?
Socialize. It was a nice day out. I was having a fire to burn some brush in my backyard, and thought it'd be nice to invite them to come over and get the kids out and enjoy a nice day.
And what was Lindsay's demeanor that day?
I'd say quieter than normal.
And do you recall saying previously that the weekend was fairly normal, that Lindsay had always been a little tough to get a beat on, kind of quiet, but you were in the kitchen talking and it seemed normal?
I mean, in the kitchen, we had a conversation, and that was normal.
Normal, okay. Do you recall describing the day previously as a perfectly normal afternoon, really nice?
It was a nice day, yeah.
And so there was nothing out of the normal that happened that day in terms of Lindsay's behavior or demeanor?
Her behavior, demeanor appeared normal.
Okay. Did you have any problems communicating with her when you had conversation in the kitchen?
No.
How long was the family there at your house that day?
Maybe a few hours.
And during that time, I believe you described it previously as a normal, great day. Would that be accurate?
Yes.
Okay. Thank you.
Mr. Reddington?
I have no questions. Thank you, sir.
All right. Thank you, sir. Please step down. Thank you.
Reddington said, no, thank you. No, thank you. Y'all keep shutting me down every time I try to talk. I'm not even sure I want to ask anybody anything. Okay, zoom. Let's see who we got here.
Good afternoon, sir.
Thank you. Good afternoon, sir. Can you tell the jurors your first and last name?
Andrew Giacchio,
Can you please spell your last name for the record?
Chiachio.
And what do you do for work?
I work for the state police
And how long have you been with the state police?
since December of 2013.
And what's your current assignment?
I work for the Plymouth County State Police Detective Unit,
How long have you been with the State Police Detective Unit?
5 years,
And what's your current rank?
sergeant.
I do have this sped up a little bit. It is only on 1.15, so if it becomes too much, anybody in chat, just say something and I will gladly slow it down. Or if you can use on your own phone or device, you can slow it down to make it easier.
Draw your attention back to January 24th of the year 2023. Were you still working for the State Police Detective Unit with the District Attorney's Office then?
Yes,
And do you recall being called into an investigation in regards to an incident that happened in the town of Duxbury on January 24th, 2023?
yes,
Were you assigned as the case officer for that investigation at that time?
no,
But you're aware that a number of the other troopers in your unit were all called out to do
No.
different parts of the investigation.
yes,
Do you recall if you actually went first to 47 Summer Street?
yes, I did.
Were you quickly assigned to go someplace else and do some follow-up investigation?
Yes,
And one of the places that you went on that night was the CVS in Kingston, correct?
correct.
That would have been at 189 Summer Street.
Yes,
Why were you asked to go to the CVS in Kingston?
to obtain surveillance video.
And had you learned information that one of the homeowners, the Patrick Clancy, might have visited that location earlier in the evening?
Yes,
And so when you got to the CVS, did you contact somebody in the store in order to try to determine whether there was surveillance?
yes,
And did you speak with an employee there?
I did.
Do you recall who you spoke to?
Angela Kraus, she was the manager.
Were you able to get access to the surveillance at that time?
Yes,
And were you able to observe the time on the surveillance at the store as it pertains to real time?
yes.
So tell us how you determined whether the time was accurate.
We look at the live feed and I compare it with my cell phone.
And your cell phone is a department issued cell phone.
Yes,
Did you notice any discrepancies in the timestamps?
I did not.
And after viewing the video surveillance there at CVS, were you able to see Patrick Clancy in the store at CVS?
Yes,
And fair to say you were able to track that he arrived at 17:32:32 and exited the store at 17:37:08.
yes,
At some point, were you also asked to look for surveillance at a different location?
I was.
What was the second location?
The 3V restaurant
And where is that located?
in Plymouth.
And fair to say it's the address, there's 10 Cordage Park Circle.
Yes,
What is 3V?
a restaurant,
Okay, and why did you go there?
to obtain surveillance video.
Again, based on information that you had available to you, did you believe that Patrick Clancy had visited that location earlier in the evening of January 24th?
Yes,
And when you went to the 3V restaurant, did you speak with two employees there?
yes,
Were you able to access the video surveillance?
I was.
And while at the restaurant, were you able to confirm Patrick Clancy on their video surveillance?
Yes.
Now, as far as their video surveillance timestamps, were you able to observe the timestamps at that location?
I was.
And did you notice any discrepancies about the time?
No.
And what did you do to confirm the time?
I compared the live feed with my cell phone.
Fair to say you were able to determine that the video surveillance did confirm Patrick Clancy arriving at 17:54:14, that he paid for a bag of food and he left the store by the front door at 17:55:01.
Yes.
Now, in addition to gathering the video surveillance, well, let me back up for a second. So on one particular occasion, you were able to go and view the video surveillance, correct?
Yes.
At some later date where you provided with copies of the video surveillance from both the CVS in Kingston and the 3V restaurant in Plymouth.
Yes.
And you brought that back to the state police?
Yes, to the
the video
office. Yes.
Okay. Now, as follow-up for this investigation, did you learn information about the route of travel Patrick Clancy took that night to go from his home to these locations?
Yes.
Did you do anything to try to ascertain approximately how much time it would have taken him to go to these locations from his home at 47 Summer Street?
Yes, I mapped it on the Maps application on my iPhone.
Now, do you recall when you did that?
I don't.
When you did this mapping of the locations, did it give you approximate distances and times between the locations?
Yes.
And fair to say, not knowing exactly when it occurred doesn't account for the time Patrick would have been there or any traffic or accidents or anything like that,
Correct.
right? But as far as you could tell, you were just looking for approximate time frames.
Yes, the general idea.
Now, as part of this investigation, you also were involved in some interviews with potential witnesses.
Yes.
Is that fair to say? Including Paula Musgrove.
Yes.
And who's Paula Musgrove?
The defendant's mother.
And you also spoke to a former nanny of the Clancys named Elaine Flaherty,
Yes.
as well as the employees from CVS, Angela Krause and Soraya Sweeney.
Yes.
Did you also, or were you also present in follow-up interviews with all of the first responders to the home in Duxbury on January 24th?
Not all of them, but a lot of them.
So that would have been a majority of the paramedics/firefighters from the different towns?
Yes.
On June 12th of 2023, did you apply for and receive a search warrant for 47 Summer Street?
Yes.
And why did you ask for a search warrant then in June of 2023?
We were reviewing photos, crime scene photos, and someone noticed that there was potentially blood stains on the outside of the house that we had not swabbed.
So to your knowledge, on the date of the incident on January 24th, the stains on the outside of the house were not swabbed and collected by the crime lab, right?
Correct.
Did you have further conversations with forensic scientists at the crime lab to determine the viability of obtaining additional swabs all those months later?
Allow that the question just yes or no. Did you speak to somebody, not the answer?
So did you speak to somebody at the crime lab about the possibility of obtaining some biological substances from the home?
Yes.
And as a result of your conversations, did you then apply and were granted a search warrant?
Yes.
So subsequently, some swabs and shingles were collected from the home at 47 Summer Street?
Correct.
And were you present when that was done?
I was.
On May 15th, 2024, did you have the occasion to go to the Tewksbury State Hospital?
Yes.
And what was the purpose of going there?
To collect DNA from the defendant.
And is there a particular procedure that you, as an investigator, use in order to collect a DNA sample from somebody?
Yeah, we use a DNA collection kit. It has a foam swab that you use to swab the inside of a person's mouth to collect saliva. That's then transferred to a collection card. We let it dry, then seal the kit.
So the swab kind of looks like a lollipop
Yes.
with a foam end.
Yes.
And you're trained on how to swab the inside of a person's cheek on both sides in order to obtain an adequate sample?
Yes.
And you did that in this case?
I did.
Who did you collect the sample from?
The defendant.
And that would be Lindsay Clancy?
Correct.
Were other people present when you did this?
Yes.
Who were they?
Sergeant Josh McCalligan, DPH Police Chief Michael Riggs, and Attorney Reddington.
What did you do with the sample that was collected from the defendant on May 15th, 2024 at the Tewksbury State Hospital?
It was placed in a temporary evidence at the DA's office.
Was that sample then later transported to the State Police Crime Lab?
Yes.
Now, another thing that you did in this investigation sometime later was seek search warrants to Facebook, or what's known as Meta, correct?
Correct.
As well as a particular Facebook group called Attachment Parenting for Littles.
Correct.
As a result of that warrant, did you receive data back from Facebook?
I did.
And were you able to confirm a Facebook page in the name of Lindsay Marie Clancy?
Yes.
Were you also able to confirm that there's a particular post by the person named Lindsay Marie Clancy, or the Facebook page Lindsay Marie Clancy, on May 5th, 2021, to the Attachment Parenting for Littles group?
Yes.
I'm just going to approach.
You may.
I have no problem with the phone.
No objection? Okay.
I'm just going to show you the document. Is that familiar to you?
Yes.
And is this the Facebook post posted by Lindsay Marie Clancy on May 5th, 2021?
It is.
No objection? That may be admitted.
Sergeant Cacchio, just showing you what's now been marked as Exhibit 217 on the screen. Is that Facebook?
Oh, I'm going to actually read this. Lindsay Marie, hello, lovely parents. I'm looking for some, I don't know if she's going to read this. That's why I want to go ahead and read it. Looking for some advice, solidarity, ideas, something, anything. I'm truly finding my 19-month-old to be the most difficult human I've ever encountered. I mean that with all the love in my heart, but I honestly cannot make it through a day without getting so frustrated
Is that
with him. He is not my first child, so not to compare because I know that every child is different, but just for background, it isn't my first rodeo. Every single thing with him is a battle, and it has been this way for a while since he was maybe 8 months old. I really try to pick my battles and only do what's completely necessary, but I mean everything. Getting out of his crib in the morning and going downstairs, changing his diaper, getting him dressed, getting him in the seat to eat, getting him in the car seat, getting him out of the car seat, putting on his jacket and shoes to go outside, having him come inside when it's time, going to sleep for his nap, and at night. And at night, he fights me every step of the way. And that's all I can read.
and you were able to locate the content of this post in the records for the Attachment Parenting for Littles and confirm that it also appeared to be authored by Lindsay Marie Clancy, correct?
Correct.
Or by the Facebook page of Lindsay Marie Clancy.
Yes.
And fair to say it reads, hello, lovely parents. I'm looking for some advice, solidarity, ideas, something, anything. I'm truly finding my 19-month-old to be the most difficult human I've ever encountered. I mean that with all love in my heart, but I honestly cannot make it through a day without getting so frustrated with him. He's not my first child, so not to compare, because I know that every child is different, but just for background, this isn't my first rodeo. Every single thing with him is a battle, and it has been this way for a while, since he was maybe 8 months old. I really try to pick my battles and only do what's completely necessary, but I mean everything, getting out of his crib in the morning and going downstairs, changing his diaper, getting him dressed, getting him in his seat to eat, getting him in the car seat, getting him out of the car seat, putting on his jacket and shoes to go outside, having him come inside when it's time, going to sleep for his nap, and at night, he fights me every step of the way with all these normal daily activities. It constantly feels like I have to force him to do these things, which feels so wrong, but he is always fighting me and crying about doing these very normal things. You recall seeing that message in the records.
And the reason I did read that is because I know Reddington is wanting to speed this along, and this may have been something that may have been just said, put it on the record, blah, blah, blah. The jury can read it later. That's why I wanted to make sure it was read.
I do.
And fair to say there was some comments to the records and also an acknowledgement by the person with the Facebook page, Lindsay Marie Clancy, thanking the contributors for their advice.
Yes.
She was seeking help. I mean, I get it. She was seeking help. She wanted help from anybody that would listen. Hey, K-Swan.
Good afternoon, sir.
Oh, Reddington, please be kind. In front of a microphone, Reddington.
Parenting for Littles, post by Lindsay, correct?
Correct.
And this was back in May of 2021?
Yes.
And she was talking about
This
her
was
son,
May in
who at the time was
2021.
19 months old?
That's correct.
Now, as a state police officer, you know how to investigate things, right?
Yes.
You guys must have turned things inside out to find out if Lindsay Clancy was ever abusive to her son Dawson, right?
That's correct.
Found nothing, did you?
No.
Thank you. That's all I have.
Anything on that?
No, thank you.
Thank you, sir. You may step down.
Thank you, Your Honor.
I'll just stop, Lisa.
Sure.
That was an old post. I can't believe. I mean, I understand
Back tomorrow, 9 o'clock, a little bit of a while. So I'm going to excuse you for today.
he's
Back
leaving for the
tomorrow,
day.
9 o'clock. One of the questions I asked over here was, where are we on the time estimate? All right. I'm told
Oh,
that
but they
we
talk.
are on schedule, if not.
Don't
ahead of
leave.
Schedule, in regards to what we told you. All right. So I'm going to excuse you till tomorrow. We're going to stay here, do a few more things. And I'm just going to remind you, as I've said every night, you have to have an open mind. Don't talk about this with anyone. Don't do any research about anything. If you see anything about this.
Lindsay Clancy.
Okay.
Parties are
I
present.
want to see what they stayed for.
All right. In regards to the defendant's motion for permission to call witnesses, I know.
Okay. See, I hear things. I don't always see everything, but I heard, and I don't want to give rumor, but that the prosecution was going to rest tomorrow. The Commonwealth was going to rest tomorrow. Now, I don't know if that's why that they're discussing this, but let's listen in because I want to know now.
Was hear the arguments in regards to the defendant's motion for permission to call witnesses. I know that this was filed this morning, but it's kind of hand in glove with issues that were raised a couple of weeks ago. Same, at least mentioned the same witnesses. So, so I'm going to hear first from the defendant. They'll hear from the Commonwealth. I will probably take it under advisement and review some of the other documents, but I want to make this decision as soon as I can, so everybody kind of can plan on how they go based on the decision. So, so Mr. Reddington, let me hear you first on this.
Thank you. Your Honor, obviously, I don't have to belabor the obvious. This is a murder trial, very serious business. And we've all been working very hard on the discovery, which, as you can tell, is voluminous. Hundreds and hundreds and hundreds of pages of state police interviews. And I mentioned, about with the government. They have cops, they have people going out and interviewing, they have videos, they have chemists, they have detectives, they have local cops. They want a cup of coffee, they can send 5 cops down the street to get one. I'm it, except for my son Patrick, who helps me out getting coffee, all right? And the reason I sound frustrated is that they're objecting 2 weeks ago because they need time to review, to cross-examine doctors.
What is he doing?
On very basic items of evidence that are their items of evidence. Not one of those witnesses is adding or bringing anything new to the discovery, if you will. And not by way of excuse, but, I am a sole practitioner. In the past, May, June, July, in the past 3 months, I've had a murder, a rape, and 2 back-to-back federal trials that ended 1 week before we impaneled on this case. I have worked really hard to pull this case together with expert witnesses, civilian witnesses, private investigators been investigating. I provide everything to them as soon as I get it. And they have been doing the same with me. I haven't objected to one thing that they have offered. They put an AutoCAD computer animated display disc on my desk last week. I didn't complain about it, run to you and try to exclude it. I said, fine, no problem, put it in my pile and move on. That's it. So to suggest that they need time to be able to cross-examine both, I've had trials with both of these prosecutors. They're both experienced. They're very, very familiar with the trial of major criminal cases. I feel that they're more than capable of being able to cross-examine, for example, number one, Dr. Volkovich, who is a board-certified emergency medicine physician. His report indicates that he has taken a look at South Shore Hospital. He's taken a look at the Brigham and Women's Hospital. He's taken a look at the photographs. That's their evidence. That's all he looked at. And all he's doing is basically what all of their South Shore doctors came in and testified to as to the nature of the injuries, in his opinion, the type of injury that she suffered, talking about the injuries to the right and left wrist as well as the neck. In his opinion, dealing with suicide attempts that it's a legitimate suicide attempt. There's no secrets. There's nothing new that they have to prepare to cross-examine him on. Dr. Laposada is a doctor that is well known to most of us, and I've been using Dr. Laposada's fine services for the past decade or longer. I know that both of these attorneys are familiar with her. She's not bringing anything new to the table. She's bringing her opinion based upon their evidence as to the medical records, x-rays, all of the rest of the indicia of the injury that she suffered. Now, they're talking about Lindsay going out and hanging off of a window and then doing, like I said, the Spider-Man slide down the side of the house, apparently. Absolutely ridiculous. She dove out that window, she hit her head, and she suffered what Dr. Laposada refers to as a Jefferson fracture of the spine that is very, very, very typical for this type of an injury. When somebody dives into the shallow end of a pool, they get that injury, unfortunately. When somebody...
Sorry, y'all. I'm sorry. I just squirreled so bad. I just squirreled so bad. Reddington, what do you do? I just thought about... So, this weekend coming up, my guys are going to see the Spider-Man movie. We hear it's great. Sorry, the Spider-Man comment totally squirreled me, guys. I'm so sorry. It's y'all, I can't. I'm sorry. I know this is serious.
You know, kids are on a boat and they're drawing very, very typical for this type of an injury. When somebody dives into the shallow end of a pool, they get that injury, unfortunately. When somebody, you know, kids are on a boat and they're drunk and one of them jumps off a mast into the shallow end of the water off of Cape Cod, they get that type of injury. Superman, when he gets thrown off the horse, 6 feet high, same injury. That's all. She's not bringing any esoteric theory to this case that they need time to prepare. Interestingly enough, the Brigham and Women's Hospital records do.
I agree,
to the
Cindy.
Jefferson fracture, right from jump. She
I'm
also
just,
assists me, as she always does, on autopsy photographs, any indicia of injuries, and it's her opinion that if they try to say that there are bruises to these little babies that were inflicted by her, they're absolutely wrong. And Dr. Laposada would indicate that these are consistent with either EMT. God bless those first responders, but they were in a panic and they're trying to take care of these kids and pick them up and run them up to their trucks and vehicles. So, and other, obviously, the interosseous injection into the legs, the shins, the thighs, all of these bruises are from medical intervention, not Lindsay Clancy. That's what she would testify to. That's it. They don't need time to prepare to cross-examine for that. Finally, I have Dr. Condi. Dr. Condi signed even better than a report. He signed an affidavit. And again, it's based upon medical records that we all have. Way back when this case first started, the government presented the case to the grand jury. First thing I said to Lindsay was sign a release. Let the government get all the medical records. We'll all have access to them. This case is obviously going to be predicated upon the medical records, psychiatric records. We signed every release. They got every document and had them into the grand jury. I got copies. They have copies. Condi would testify to the horrific, in his opinion,
with you, Cindy.
Failure to comply with the standard of care.
It's
that would govern
unfortunate.
Psychiatrists.
I will interrupt him. It is unfortunate, but this is the best.
Failure to comply with the standard of care that would govern psychiatrists, psychologists, Dr. Tufts, who's going to be testifying tomorrow, nurse practitioner Gelada, the other individual from the McLean Hospital, all records that they've had for years. So they don't need time to prepare for cross-examination. So weeks ago, counsel, after I gave them copies of all of these reports and affidavit, strike that, I'm sorry, the reports I just got, and I just sent them the affidavit from Condi they already have, I disclosed to them what my opinion would be of the opinions from these doctors that would be testifying, and the report carries that out. I suggest to the court that to strip Lindsay's ability to present evidence in support of her defense, number one, it would not be in the interest of justice. I'd like to hear a DA stand up and say, in the interest of justice in this case, because weeks ago we got this information and we're not prepared to testify, to cross-examine the testifying witnesses, I think even Your Honor would agree is a disingenuous argument. She came in and said to you, well, Rule 14 matters. And it applies to the government just as it applies to the defense. And therefore, you should exclude these witnesses. Well, if I messed up and it's my trial schedule that caused me to not be able to have written reports of the stuff that they've had for years to prepare to cross-examine these witnesses, then it's my fault. And it deprives her of effective assistance of counsel, because that would then deprive her of her defense. This is a pathologist, an emergency room doctor, and a doctor who would testify to the standards that would apply to these doctors that they're going to call as their witnesses, which is another interesting fillip, if you will, where they're calling Tufts, Gelada, the other individuals from McLean, all treating physicians of her that are all lined up to come in and testify against her on this case. Fine, bring it. But at least give me the ammunition to counter it.
Let me ask you this, we kind of go backwards. In regards to Dr. Condi, the affidavit really speaks more towards the standard of care.
That's right. He's not giving an opinion of criminal responsibility.
Right, but I'm struggling to see how that comes in. Now, maybe.
Well, he's the
Right.
doctor that I'm using for
Right.
toxicology.
That's what I feel. But the reason I'm asking that is, I'm not sure in this case, is the standard of care necessarily as relevant as opposed to causation? Do you know what I mean?
Well, yeah, I think the standard of care does speak to causation. He doesn't have to use it as standard of care. He can use it as his opinion as to the first doctor that she spoke to, Dr. Tufts, when she presents with a bipolar 1 presentation, and then Tufts prescribes an SSRI to her, which flies in the face of any rational psychiatrist and what they would prescribe and do. He's more than qualified to testify.
No, that's a different question. And that may be more admissible than someone saying, oh, I found what the standard of care, and I find that this violates it. If we have got an expert who says, listen, I am qualified, I looked at these records, I disagree with that treatment, I'd be more inclined to allow that than to get into the standard of care, which is obviously consistent more with the civil world.
So with that, I can reach out to Dr. Condi and have him delete reference to standard of care in his report and address the actual treatment as to an opinion as to its appropriateness. But again, on the issue that they're raising, that they need time to prepare to cross-examine, I don't think that lies even if he revises his report by removing standard of care.
Well, let me ask you this, because I haven't had an opportunity. This is probably what I'm going to have to look at tonight. Is Dr. Condi adding anything to the expert disclosures that have already been made? Because I know there's disclosures.
He's taking the medical records, Tufts, Gelada, McLean Hospital, and just commenting on the care and the treatment that was presented to her as a patient looking for help. That's all he's doing. He's not adding anything. He's talking about the prescriptions that were provided to her, the SSRIs, the antipsychotics, the benzodiazepines, all of that. That's what his opinion is predicated upon, which is all of the prescriptions that the government has already introduced into evidence and is well aware of.
Right, and but I know that the parties have already exchanged reports months ago, and I know that everybody did that. And I haven't had a chance to review specifically the defendant's reports. And I don't, is there an expert who's going to address these kind of issues already?
No, Dr. Condi was my toxicologist and my physician that would give an opinion as to the appropriateness of the treatment that she received, especially as it relates to the prescriptions. I mean, Dr. Lapisada is a pathologist. She has nothing to do with it. Dr. Zeisel is a psychologist. He has nothing to do with it. Dr. Resnick is a psychiatrist specializing in infanticide. He's not addressing that issue, and nor is Dr. Spinelli, who is a postpartum depression, postpartum psychosis expert. So Dr. Condi is my expert for toxicology and the level of care that she received.
All right.
Which guts the defense if their argument that they need time to cross-examine or prepare results in an exclusion.
Okay, come on.
Thank you, Your Honor. With regard to Dr. Condi, one of my points is going to be that his affidavit addresses the standard of care, which is more of the civil issue, but you've already addressed that with defense counsel's pivot that he would then instead testify about the treatment of the defendant in toxicology. Looking at the affidavit in which he outlines his qualifications, he's not a toxicologist. He's a physician licensed here in Massachusetts. He's done a residency in general psychiatry, child and adolescent psychiatry, and forensic psychiatry, but he's not a toxicologist. And also, it's not just us having all the same records that makes for cross-examination to be fundamentally fair. There's more to cross-examination than just having the underlying data. It's also knowing more about the expert, being able to look into their publications and their prior testimony, and being able to prepare to rebut anything that they might testify to. And where we have this late disclosure, which was 1 week prior to trial starting, that's fundamentally unfair to the Commonwealth. And I think what Dr. Condi would be testifying to, if it's just limited to her treatment and what was prescribed to her, that's covered by the other 3 experts that defense already has. They all talk about her treatment, the prescription she was on, and the effects those had on her. So I think that would be redundant, and it would be unfair to the Commonwealth to add this 4th expert to talk about the same things that the other 3 experts are going to talk about when we haven't had a chance to prepare for this particular expert. For Dr. La Posada, what we have is a 2.5-page letter to Attorney Reddington outlining her thoughts, but it doesn't say what her opinions are based on. It doesn't say which materials she's reviewed and what she's relying on. So I would suggest that it's an insufficient report. And again, with the delayed disclosure, for example, she talks about Jefferson fracture causing the injury. So if we had this information previously and knew this is what they were going to argue, we could have obtained our own expert to talk about the mechanism of injury and Jefferson fractures and all of those things. But we weren't told until a week before trial that she would even potentially be a witness. And then we get this report on July 26th. That's a 2.5-page letter.
But didn't we have multiple trauma surgeons, neurosurgeons, who've testified, who treated her? Couldn't someone just ask, is that consistent with, and that's pretty much, if I'm looking at Dr. La Posada's note, I'm not sure I would allow in opinions regarding whether or not it's a serious suicide or not, but she does indicate it's consistent with landing on somebody, on an individual's head.
Well, Your Honor, we had a trauma surgeon from the South Shore Hospital testify who said that the injuries that Ms. Clancy sustained were a level 1, and she had to be transported to another hospital where doctors who were trained in those injuries could operate on her. So we didn't think that she would have the knowledge and the training and experience to testify about the nature of those injuries and how they occur. The trauma surgeon from Brigham and Women's Hospital is with the military and is overseas in the Middle East, and so was unavailable. But had we known that this was going to be an issue and they were going to allege this particular type of fracture, we would have endeavored to get another expert in replace of the doctor who treated her at Brigham and Women's. But we didn't know that this would even be an issue until a week before trial. And again, this letter is dated July 26th, and it doesn't tell us which records, which reports, or which what medical journals or training or anything that these opinions are based on.
Well, that could be done by voir dire. I mean, the Commonwealth has at least inferred through their case that this was not a serious suicide attempt, right? I mean, and there's questions about whether or not somebody's hanging outside the window or not. And so why wasn't this an issue that the Commonwealth could have anticipated would come up?
The position of the Commonwealth isn't that it wasn't a serious suicide attempt. It's that the methods that were chosen were insufficient to achieve the goal. And the reasons.
This woman, did she say, I swear to God, she just said, I'm going to rewind.
And so why wasn't this an issue that the Commonwealth could have anticipated would come up?
The position of the Commonwealth isn't that it wasn't a serious suicide attempt. It's that the methods that were chosen were insufficient to achieve the goal. And the reasons for that, we would argue in our closing. I don't think we have to disclose that theory at this point, but we've never said it wasn't a serious suicide attempt. We've never said it was a fake suicide attempt. What we've endeavored to develop from the testimony is that the methods that were chosen were methods that would be unsuccessful, but we're not saying it wasn't a serious attempt. And I think the reasons for that will become clearer when the doctors give their testimony. But it's our position that she was attempting to kill herself that night. And there are various reasons and factors where she was unsuccessful in killing herself, but successful in killing her children.
But there's been all kinds of testimony
I swear to God, I'm gonna puke. What in the fuck?
Regarding, it seems to be a dispute of whether or not she's hanging from the windowsill or goes out head first. There's some testimony that's been raised, even with the blood experts, things that she may have been hanging from the windowsill. Dr. Lapasato, it seems what they're seeking here is those injuries are consistent with somebody who lands on their head.
So would the court allow us to call a witness who's not on our witness list to rebut that evidence?
Yeah, I would consider that. Sure.
I would have no problem
Yeah.
with that.
And this is kind of what, why I didn't make a decision on this earlier, because I had to kind of see how the case develops. And this issue of how this injury occurs is certainly, it's either been specifically and explicitly raised or inferred in multiple questions. Even to the length to the part, the cuts and things like that. It's been over and over and over. So if the Commonwealth seeks to get somebody to rebut that, I would strongly consider that. And in regards to Dr. Lapasada's opinion, we may need a voir dire in regards to, but I wouldn't imagine the voir dire would take that long. It would be, did you view, the x-rays? I mean, that kind of an injury is probably pretty clear on the x-rays or the MRIs.
If we could get a list from defense counsel on what she's basing her opinion on, so we can have our witness review the same material.
I'm just telling you right now, it's just simple. It's just the South Shore Hospital medical records, Brigham and Women's medical records that have already been discussed with the jury.
Why don't we do this, just so it's clear, because when a witness is on the stand, it's much easier to have something in writing to say, is this what you relied on? So if you could get from Dr. Lapasada what she is relying upon to form that opinion, I'm like I said, I'm inclined to allow that opinion, and I would allow then the Commonwealth to present a rebuttal witness if they seek to.
And just note our objection to that, but also the third expert, what we have here is a letter dated August 4th. That's a page and a half. That's not even signed by, I believe it's Dr. Volkovich.
Yeah. I'm more concerned with that is whether or not the opinion is admissible. The opinion, as I see it, is he's reviewed the medical records, and it's his opinion these are injuries that commonly observed in the quote, serious suicide attempts.
We could delete serious.
Yeah, I mean, or even suicide attempts. That's an opinion.
Their doctors waxed eloquently about suicide and whether or not it's, I mean, we could delete serious.
But I'm just concerned that how are we going to kind of parse out what he looked at? 100 other cases, and then we go through into all of those. So I'm going to have to take a look. That's what I'm going to take under advisement for sure. That doesn't mean he may have other opinions I'm going to have to look at. I think he talked about some of his observations as an emergency room doctor, I think, didn't he? Yeah, I'm more reluctant to allow in that individual's opinion that this was a suicide attempt.
So their South Shore doctors are able to talk about, superficial, as we've heard for a week now, but his opinion that it's consistent with what he's observed in his emergency room treatment is not admissible.
No, that's not what I'm saying.
Oh, I'm
What
sorry.
I'm saying is that he can't necessarily give the opinion, I've looked at this, it's my opinion, this was a suicide attempt. But he could certainly testify, I've looked at the cuts, these are, the phrase superficial. I think that's been kind of mixed up in this whole thing too. That seems to be more of a medical term.
Thank
as
you.
Opposed to
Well, no,
that.
they basically beat it to death with not being a medical term until we were able to show that in fact it was deep, 3.5 and 2. Okay.
Yeah, I mean, if you want to call this doctor, he's going to say, that's a significant cut.
Okay.
That's different than saying, looking at that, I find that this is a suicide attempt. Just like there's never been an opinion here that this was not a suicide attempt. That's probably something that the jury
now, but it wasn't a week ago.
Well, that's going to probably be for the jury to determine. But I would allow kind of going into the characteristics that have already been testified to, So, and I don't, we need a further voir dire on that doctor as well. But I think he listened there, kind of what he reviewed, but yeah. All right. Anything else in regards to those three witnesses? All right. So I'm going to take this under advisement, but just kind of for what I'm inclined to do is I'm going to take a look at Dr. Condi's report and compare it to some of the other reports. I'm inclined to let Dr. La Posada testify to that the injuries are consistent with basically a fall on the head. And the last doctor I've got to take a look at kind of his language, but I would not be allowing in that his opinion that this is a suicide attempt. But he may testify as to all the other observations that he took from those records. All right.
Understood. Just no objection for what it's worth.
All right. And so I'll note the Commonwealth's objection. I'll note the defendant's objection. And so, and like I said, I'll take it under advisement, and everybody can renew those objections
As it
again.
relates to Condi, once you make your decision, you let me know. I can certainly reach out to him and have him delete this standard as to standard of care and just reference the actual treatment and prescriptions that you received.
All right. All right. So I'll take a look at this. I'll have this tomorrow morning for everybody when you come in.
Great.
All right.
Thank you.
So anything else we need to address?
Just in case there's a problem, Dr. La Posada has been working with a gentleman by the name of Mr. Drake, Drake Laboratories, that is putting together an auto computer animated display of coming out the window, the injuries to the neck, showing the vertebrae and that type of thing, which is all based upon evidence that's already in evidence here. So I haven't got it yet. It's not done yet. So I don't want to not say anything about it now because they'll be objecting to it tomorrow, I'm sure. Or
I
whenever it's ready.
assume we'll have to take a look at that and give the Commonwealth the opportunity to view it and hear the arguments in regards. It may be something nobody has objection to, or maybe, I don't know. All right.
Would have an objection to it, and it
You
goes
don't
back-
know. You haven't seen it.
So it goes back to the whole position that, we have the right to, if we want to obtain another expert, and then the
Sure.
expert could review that material and use it to form his opinion. This is different than the 3D diagram of the house that the Commonwealth gave. The defense was on notice that was coming, the basis of it, the measurements, what the house looked like itself, and so that was turned over. This is completely different.
And I just note that, as I said, the medical records that the government has talks about Jefferson fracture. You might remember 2 weeks ago or 2.5 weeks ago when they first raised their objection, I told you that I can't know what they're going to argue until they argue it. So I didn't know whether or not they were going to say that it's a fake suicide or that she didn't jump out the window. I had to wait to see what their opening was. Now I know I have to rebut it.
We were almost out of here till you mentioned that
Yeah,
3D
sorry.
thing. So why don't we do this? We'll wait on that. All right. I'm not committing one way or the other in regards to that. We'll see. So you maybe the testimony with the 3D, the testimony without the 3D. We'll just kind of see where we go. All right. All right. So thanks everybody for kind of buckling down and going through that so we could.
He says, "No, ma'am. I'll see y'all tomorrow." He says, "I'm done." Y'all, this is crazy. So okay. So she after she cut both her wrists and her neck, she stood on the edge of the windowsill, put her hands together, and jumped. Swan dive. What the fuck are we doing? Why are we even questioning? She's already said that she took the children's life. She tried to take her own life. She fake it till you. Here you go, case one. I'm with you. I mean, and again, so if she just broke her leg, that means she was trying to get away. She was running. Yes, that's why she jumped out the window, because she wanted to run away after slicing her hands and her throat. Get out of here. And look, y'all, I'm just going to show y'all. This is why I don't go into other chats. This is what somebody put in another chat. Y'all stop that shit. Stop that shit. What is wrong with people? What in the actual hell is wrong with people? Look, I had a thing set up for Vinny because it was a thing about being a free woman. I have really bad thunderstorms going on right now, and I don't want it to knock my internet and my power out because I know that where I live is known for that. So I don't want to be all like rude and anything, and my internet shut down in the middle of this because I can tell I'm already doing a little bit of buffering. So, anyways, it's been a long day of trial. We got to see from many different people, many different of her some of her friends. We got to see from her ex-father-in-law. Yeah, Vinny's been a rough watch. You're right. But this was a very good. You know what? I'm gonna just drop it in the chat instead of actually reviewing it. Like I said, I'm really worried about my electricity going out. Why didn't it drop? There you go. And it's more or less talking about, would she be a free woman and what would happen if she was actually released? It's kind of an interesting listen to. I got a little bit of information out of it. So, real quick, it's been an interesting day. I'm sorry, but my electricity is fixing to go out.
You is smart. You is kind. You is important.
Anyways, thank you all for hanging out, and I will see y'all tomorrow at noon Central Time also for day 9, postpartum psychosis or premeditated murder, Lindsay Clancy trial. See y'all then. Bye. Rubber.